Wonderful. So good afternoon and welcome to bill hearings to the House Health and Government Operations Committee. I'm your chairman, Jocelyn Peña-Melnick. My vice chair is Ariana Kelly. This is our first session back in person since 2020. So I ask for your patience if we encounter any technical or streaming issues. Please set your electronic devices to vibrate and don't hold conversations in the committee room while the testimony is happening. If you need to do that, just go outside. We're going to hear from the bill sponsor and the bill sponsors panel, followed by an all-in witnesses, favorable, favorable with amendment, and unfavorable. Then all virtual witnesses, the same thing, favorable, favorable with amendment, and unfavorable. It's just a lot easier for us to do our work. Today, we actually have our counsel is Lindsay Rowe. The bill sponsor testimony is not limited. However, please don't take a long time so that I don't have to be rude. I don't like to do that. The rest of the witnesses, they get 2 minutes to provide testimony. A timer is displayed on the left where the seal is on the screen, and a sound will play once your time has expired. Please listen to that sound. Please adhere to our usual committee rules of 1 question and 1 answer from the panel, not 1 question and 1 answer from each witness. Please just ask the question. Please keep your questions brief. Members of the public will be able to view the live stream of this hearing on the Maryland General Assembly website and the YouTube channel. Today, we will hear the bills in the following order. We're going to start with the House Bill 124, House Bill 245, 141, followed by 241, 242, House Bill 58, 234, 238, and the last bill of the day, House Bill 63. You are going to see that some of our members are coming in and out. It's not meant in a disrespectful manner. Is that they have hearings in other committees, so we have to be a little flexible, but we are paying attention, and they can also view it later on. Some of our members are not feeling well, but they're watching from home as well. And if you see testimony that is written, we also consider that as important as oral testimony. Let's begin with the Speaker's Bill, which is House Bill 124. And we have with us Ms. Jody Chilson, will be testifying on behalf of the Speaker. So let's get started. And good afternoon, Jody.
Good afternoon, Chair Peña-Melnick, members of the committee. My name is Jody Chilson, and I'm an assistant manager for bill drafting for the Department of Legislative Services. And I coordinated our mandated reports review project that led to HB 124. And thank you for letting me just give you some information about that project and the bill. So every 4 years, we're required by statute to look at all the mandated reporting requirements that require that reports be sent to the General Assembly or the governor. And so we took up that review this past interim. And what that review entails is policy analysts from our department use the tracking reports that our library keeps on all the mandated reports. And we contact the affected entities to see if they have recommendations for any changes. Through the statute, we're required to focus on whether reports are obsolete, duplicative, impractical, inefficient, or otherwise unnecessary. And once we get recommendations from the entities, we will do research on our own and then determine whether we should recommend any changes to the reporting requirements. We completed that, and as required, then we submitted a report to the Legislative Policy Committee, and that report included draft legislation to implement those recommendations, and that is what turned into HB 124. So I'm happy to answer any questions you may have on the report or the bill.
Thank you. And if I have one correction, if I may, we
Sure.
do have a longer list. It's House Bill 124, 245, 141, 241, 242, House Bill 58, House Bill 234, House Bill 238, House Bill 63, House Bill 165, House Bill 220, and House Bill 172. So it is a longer list, and thank you for your indulgence. And thank you for your flexibility, Jody. Are there any questions regarding this bill? You are just amazing. There are no questions.
Thank you.
Okay. Thank you so much for being with us today. So we have, that was basically it. And you want to go ahead? Okay, yeah. So we have on 124, thank you for, I tell you, I count my blessings for our staff. There's some amendments to be offered by me on the bill, and that is in your package, and it's amendment number 723320. So it will be assigned to the subcommittee. The subcommittee will discuss the amendments, and you'll get a chance to give your input as well. But they're in the package. This will conclude the bill hearing on House Bill 124. And we're going to the next hearing, which is House Bill 245, Delegate Woods, Minority Business Enterprise Program Reporting List of Units. And while she comes up, if her panel can come up as well, that will be wonderful. And I believe that you do not have a panel, it's just you.
That's correct.
And you are enough. Go ahead and get started.
Good afternoon, Madam Chair, Vice Chair, and members of the Health and Government Operations Committee. I'm Delegate Woods, representing Legislative District 26 in Prince George's County, Maryland. I'm here today to request a favorable response to HB 245 entitled Minority Business Enterprise Program Reporting List of Units. And I'm here today in alignment with our governor's goal to leave no one behind and to further enhance MBE participation in state procurement. This bill would establish a system where the Office of State Procurement in the Department of General Services would be required to compile and maintain an accurate, concise list of certain units, also referred to as reporting sources of the executive branch of state government and their affiliate units, to make sure that information is annually reported to the Governor's Office of Small, Minority, and Women Business Affairs, also known as GOSBA. This is really a simple request. The challenge is that there are concerning gaps in a comprehensive compilation of reporting units, which results in incomplete information provided to the Department of Legislative Services Library and the Joint Committee on Professional Oversight. In order to protect the accounting of minority business interests, it is paramount that we assure that their diverse inclusion and quality participation in procurement contracts in the state of Maryland is intact. Accurate documentation is imperative, and to have the Office of State Procurement's accurate list of all units required to report the certification agencies within 90 days following the end of the fiscal year would resolve this current issue. Thank you.
Are there any questions for Delegate Woods? Delegate Bagnall?
I don't know if you saw the amendments proposed by by GOSBA, but are these amenable to the sponsor?
Thank you, Delegate Bagnall. Yes, we do have proposed amendments by GOSBA, and they are amenable.
Okay, wonderful. Any other questions? Can I just say you are a pro? You're like, you've been here like forever. Great job.
Thank you so much.
Good work, good work.
Thank you.
So I see no other questions. Thank you so much for your testimony today. And this will actually conclude the testimony on House Bill 245. Next, we have House Bill 141. Delegate Shi, you came right on time. Look at that. State Government Commission on LGBTQIA+ affairs alterations. And if you have someone with you, you could bring them. Otherwise, you can get started. Good afternoon.
Good afternoon. Could I ask Lee Blinder to play?
Absolutely. You can bring your panel up. You can get started.
All right. Good afternoon. Thank you, Madam Chair, and the members of the HGO Committee. Thanks to this committee's support of my bill 2 years ago, we now have a Governor's Commission on LGBTQ affairs. in the state of Maryland. And since the commission's establishment a little over a year ago, the commission has been hard at work on community outreach across the state of Maryland, data collection, and advocacy. As you can see in the report the committee should have received. This bill makes 2 administrative changes to the name and the number on the commission to make the commission more inclusive and reflective of today's Maryland's LGBTQIA+ community. First is the name change from the Governor's Commission on LGBTQ Affairs, which is the current name, to the Governor's Commission on LGBTQIA+ Affairs. The addition of questioning intersex, asexual, agender, aromantic, and other Marylanders better reflects the growing diversity of this community. Second is adding 6 additional commissioners to the commission, bringing the total number from the current 15 to 21. In fact, many other commissions within the Governor's Office of Community Initiatives, GOCI, have just about 21 members as the average. So this is more on par with the rest of the commissions. The commission felt the need to expand the seats to ensure representation of all the diversity within that larger and growing community. For example, one of the most vulnerable groups are within the larger LGBTQIA+ community are the Black transgender Marylanders, which currently is not represented on the commission. And also, there's no representation from Western Maryland or Eastern Shore. So we feel it is important to add more seats. And also, we have a couple of minor amendments that the committee should have received. One is the redundancy of the word woman, it will be crossed out, and the other is adding a few phrases to make sure all elements of diversity are properly included in consideration of the selection of members. And the commission's seats are staggered, so there will be some continuity. And that's basically the gist of the bill. It's a fairly simple, technical, administrative bill. So thank you very much for your favorable consideration, and I'm going to turn it to my favorable testimony here.
Wonderful. Good afternoon.
Good afternoon. Thank you so much for having me, Honorable Chair Pena Melnick and esteemed committee members. My name is Lee Blinder. I use they, them pronouns, and I'm the Executive Director of Trans Maryland. Trans Maryland is a multiracial, multigender community power building organization for Maryland's trans community. In addition to that, I also serve as the policy chair for the LGBTQIA Commission, or soon to be the LGBTQIA+ Commission for the state of Maryland. And Trans Maryland is deeply proud to serve as Maryland's transgender rights organization. The Maryland Commission on LGBTQ Affairs really needs this small modification and update to the bill language in order to properly represent, as Delegate Chi mentioned, all of our Marylanders. We want to be sure that we're representing the geographic diversity as well as the socio and economic diversity of our state, and correct the fact that we do have a extremely marginalized member or component of our community, the Black trans community, who are not currently represented on the commission. We really urge a favorable report on this bill, on HB 141, and I can yield the rest of my time. Thank you so much.
Thank you. Next.
Good afternoon, Madam Chair and members of the committee. Thank you for allowing me to provide testimony again today. My name is Jeremy Browning. I use he, him pronouns, and I'm the Administrative Director of the Maryland Commission on LGBTQ Affairs. And also thank you, Delegate Chi, for sponsoring the bill that created the commission, and also sponsoring these alterations. I think Delegate Chi did a good job of giving an overview, so I just want to highlight a few things. The commission recommended these changes to make the commission more inclusive of our LGBTQIA+ communities in Maryland. And we would like to increase the number to 21 members to be more representative, and that is consistent with many of the other commissions in the Governor's Office of Community Initiatives. Additionally, removing women and LGBTQIA+ persons since they're already included in the acronym. So, and I'm happy to answer any questions. Thank you.
Thank you for your work. Are there any questions for the sponsor and her panelists? There are from first Delegate Hill.
Thank you, Delegate Chi. Mr. Browning, how often has the commission been meeting?
The commission meets 6 times a year, so they meet every other month.
As if someone attends less than 50% of the time, and so if you're meeting more than twice a year, I didn't think that was too onerous. I was just checking. Thank you.
Any other questions for the sponsor and her panelist? Seeing none, thank you so much for being with us today. Thank you for your leadership, Delegate Chi. This actually will conclude the testimony on House Bill 141. And we're going to go next to House Bill 241, Delegate Bagnall, State Board of Physicians dispensing permits. And for the last bill committee, there are some amendments in there. When you see the amendments, look at them before you go to subcommittee, so you could be familiar with them, all right? And make sure that the committee gets it. While Delegate Bagnall comes, Delegate Bagnall, will you bring your entire panel, please? Thank you. And you can get started right away.
Thank you. Good afternoon, Madam Chair, Madam Vice Chair, and members of the Health and Government Operations Committee. For the record, I'm Delegate Heather Bagnall, District 33C, Anne Arundel County, here on behalf of House Bill 241, State Board of Physicians dispensing permits. You have my written testimony, so I will quickly summarize. HB 241 would increase protections for the public and expedite discipline against physicians who improperly dispense drugs. Members of this committee will recognize this bill from last year when we passed the bill unanimously from this committee following a lengthy subcommittee process, followed by a unanimous vote out of the House. This bill attempts to streamline a somewhat complicated process. So under current law, physicians in Maryland who wish to dispense pharmaceuticals from their office must apply for a physician dispensing permit with 2 parties responsible for distribution, oversight, and enforcement of standards related to these permits: the Maryland Board of Physicians and the Office of Controlled Substances Administration, or the OCSA. The board is responsible for setting requirements and standards for dispensing permits, as well as performing disciplinary action in response to infractions against those standards. OCSA is responsible for inspection of alleged infractions. So what does this look like in real life? Currently, physicians with the dispensing permit are inspected by the OCSA within 6 months of receiving their permit, and then once during each 5-year term of the permit. OCSA then takes their investigation report, forwards it to the Board of Physicians. The board then has to review the report and decide if there are any potential violations of the state's Medical Practice Act. If the board believes there is a violation, then the board has to do its own inspection in order to gather the evidence necessary to go through its disciplinary procedures in order to take action against the provider. Separating inspection, regulation, and disciplinary action between 2 agencies creates a haphazard, delay-prone process for enforcing dispensing permit standards. House Bill 241 streamlines the process for enforcing standards for dispensing permits by transferring the ability to conduct inspections on permit holders from the OCSA to the Board of Physicians. With this change, the board will have the ability to set regulations, perform inspections related to those regulations, and conduct disciplinary action against dispensing permit holders violating regulations. The OCSA will be removed from the inspections process, eliminating the need to send violations to the office before enforcement. This streamlined procedure will reduce administrative delays in the investigative process and expedite disciplinary action in a cost-effective manner, resulting in increased inspection frequency because the board will be tying the inspections to a 2-year period instead of a 5-year period. Although the bill before you is in the same posture as it passed unanimously last year, the Office of the Attorney General has requested amendments, which we are working through to ensure all parties feel confident in the change. We have offered sponsor amendments which have been provided to the committee, committee counsel, and the Office of the Attorney General. And I have late-breaking email from the Office of the Attorney General that they want to ensure that they're preserving the ability of the OCSA to keep and maintain records of ongoing and pending investigations. And we believe that the amendments have done that, have accomplished that, but we're we're making sure, so I don't want to speak out of turn. You'll also see opposition from the pharmacies, but we believe this might be a misunderstanding of the intent of the bill, and in fact, this bill more closely aligns oversight of physicians with oversight of pharmacies. We also had a conversation with Aaliyah Horton from the Maryland Pharmacists Association, who believes that if the Office of the Attorney General is good with the bill as amended, that they will also take a neutral position, but I don't want to speak on her behalf until we have confirmation for that. With all of that said, I respectfully request a favorable report on House Bill 241.
Thank you, and thank you for handling the amendments so beautifully, okay? I like that, late breaking. It's a new one. I have to remember that one. Who's next?
Good afternoon, Madam Chair, members of the committee, Madam Vice Chair. Matt Dudzik with the Maryland Board of Physicians. Thank you for having me, and thank you to Delegate Bagnall for this bill and for the hard work that she has put into it. I want to, because Delegate Bagnall so thoroughly outlined the reasons that we are requesting this bill, I don't want to repeat that. I do want to just point out one clear distinction that I think is very important, and that is between the dispensing permit and what's called the Controlled Dangerous Substances Registration. So right now, if you are going to prescribe or dispense controlled dangerous substances, you must have a controlled dangerous substance registration. That is required under the criminal law article, and it applies across the board. Through that registration, OCSA has authority to inspect, to take action, et cetera. So I think there have been some concerns that we are somehow cutting OCSA out of this process. That has never been our intent. We have worked with OCSA when we were developing this bill to make sure that that was not going to occur, because every single physician who dispenses controlled dangerous substances from their office has this permit and therefore has authority, OCSA has authority through that permit. Ultimately, this bill is about public protection. Under the current setup, there are significant delays and hurdles to enforcement that can jeopardize the health and welfare of patients in Maryland. The bill is very simple in what it does. It's a very narrowly focused bill that we believe would have significant impact on allowing us to move through the disciplinary proceedings and actually take action in some cases where we have not been able to take action in the past. We are not changing any of the requirements or standards for dispensing. Those are all remaining exactly the same. I know some of the opposition has brought up some more general concerns with the practice of in-office dispensing, but regardless of your stance on in-office dispensing, it is happening, and we believe that HB 241 would improve the process and improve the safeguards that are in place. Thank you.
Thank you. Ms. Kaufman.
Madam Chair, Madam Vice Chair, members of the committee, my name is Dana Kaufman, and I am in support of this bill on behalf of MedChi. Just to kind of pick up where Matt left off, what is dispensing? And I know many of you may not be really aware of it, but the physicians do have the authority, as long as they have a dispensing permit from the Board of Physicians, to dispense medication from their offices. This is something that only a small percentage actually does. There are 35,000 active licenses in the state, and only 651 of those physicians actually have a dispensing permit. And of those physicians, only 65% actually dispense, 35% actually dispense CDS. So the majority do not. And I'm not going to ask for anybody to raise their hand, but if you've ever gone to an urgent care center and received your prescriptions, and if you're like me, you took them while you were getting into your car, you were able to get those because those centers have dispensing permits. So that's where the public comes into this much more, and to kind of give you a better picture of it. One point that I would make is, given the fact that only 35% dispense controlled dangerous substances, the other 65% don't, but we're requiring the Office of Controlled Substance Administration to go in and do their inspections. State resources are very limited now, so this bill does free up resources of that office so they can actually concentrate on the mission of that office, which is looking at and controlling the use of controlled dangerous substance in the state. So we do think that this is a patient protection bill, and we urge a favorable vote. Thank you.
Thank you very much. Are there any questions? Great timing. Are there any questions for the sponsor and her panel? Yes, Delegate Riley.
Thank you, Madam Chair. So, yes, so I just heard what Dana just said, so thank you for your testimony. So has there been any cases to where OCSA have gone out to these other locations that do not dispense, dangerous prescriptions? Have they ever found any that have been in violation of that and they're actually dispensing those at all? Because maybe that's why they want to continue to go to all of them, because there's been some violations.
Certainly. I'm not aware of any cases where somebody without a CDS registration was dispensing CDS. Certainly, there have been violations both of CDS and non-CDS prescribers and dispensers, which we have dealt with in turn. As a point of clarification, the Office of Controlled Substance Administration is neutral on this bill. They're not opposing removing this authority.
Thank you for your question, Delegate Riley. Anyone else? Seeing none, thank you so much for your testimony today. Next, we have an unfavorable testimony, and this is from Ms. Deborah Brocato, Maryland Right to Life. Good afternoon, ma'am. You can come forward and start your testimony. How are you today?
Good, how are you? It's nice to
We're
see all of
doing
you
well.
again.
It's nice to be seen, as they said in Navier.
All right, I'm, as the Madam Chair said, I'm Deborah Brocato from Maryland Right to Life. And on behalf of our over 200,000 followers, we do strongly object to House Bill 241. This law, if enacted, would weaken existing safeguards for patients and reduce the standard of medical care. We specifically object to the reduced standard of care for the use, prescription, and dispensing of chemical abortion drugs. This bill is an overreach of the Board of Physicians. They already have plenty of responsibility, including licensing physicians and other healthcare professionals, as well as disciplining those licensees and investigating complaints against those licensees. So it would also seem to be a conflict of interest in providing quality healthcare to Maryland residents if the same people who would be prescribing and dispensing the controlled substances would also be giving themselves the permits to do so. Public policy has failed to keep pace with the abortion industry's rapid deployment of chemical abortion pills. And last year, the Assembly removed a physician requirement in the Abortion Care Access Act, which seems to be removing abortion from the spectrum of health care. So the abortion industry's radical agenda to indiscriminately sell DIY abortions, and this is what the abortion industry itself is calling the abortion pill, is DIY abortions, because women and girls take these pills home, and after taking them, they give birth to the baby on the toilet, so after taking these pills. So, and a high risk of hemorrhage and even death exists with taking these abortion pills. While we oppose all abortion, we do strongly recommend that Maryland enact reasonable regulations that would require the distribution and use of mifepristone in chemical abortions to be under the supervision of a licensed physician because of all these serious complications, including but not limited to uterine hemorrhage, viral infections, pelvic inflammatory disease, loss of fertility, and death. Maryland policymakers have put abortion politics before patients. We already have been circumventing the FDA restrictions on the remote distribution of chemical abortion pills since 2016. We think Maryland is not protecting its women and girls. The abortion industry is only concerned with abortion remaining legal. The state of Maryland has a duty to ensure that abortion is safe and must intervene on behalf of women and girls by adopting a protocol and standard of medical care for the use of abortion pills. Streamlining the dispensing permits will not make it safer.
Thank you. We did not put the timer, so we gave you a lot of time.
I really appreciate it, but we do ask for an unfavorable report on 241, and thank you very much for giving me that time.
Thank you. You got lucky.
You were very kind.
Thank you for being here. We appreciate you. Well, hold on a second. Are there any questions for Ms. Brocato? Seeing none, thank you so much for your flexibility. And this actually concludes the testimony on House Bill 241. We now will go on to House Bill 242, Delegate Bagnall, massage therapy definition and reimbursement. Delegate Bagnall, you're pushing it. You may have to provide a meal. You can get started.
Good afternoon once again, Madam Chair, Madam Vice Chair, and members of the committee. Thank you for the opportunity to speak to you about House Bill 242. Massage therapy is a common practice in medical fields related to physical therapy treatment as well as pain management, and is often recommended alongside physical therapy for recovery. Recently, efforts have been made to recognize massage therapy as a legitimate practice under the law. In 2016, a state board of massage therapists was established to train, educate, and regulate massage therapists, creating a greater platform for practicing massage therapists across the state. Despite this, massage therapy is often treated as a second-class method of care under the law. Most egregiously, massage therapy is not covered under many insurance plans and is not considered practical treatment under current statute. House Bill 242 addresses this issue by altering the definition of massage therapy to more accurately describe its intent, and by removing a provision preventing massage therapy from being covered by insurance. House Bill 242 stipulates that massage therapy may be considered treatment of illness, disease, or injury. This is necessary in order to reflect the purpose of massage therapy as a method of treating injury, often alongside physical therapy. More impactfully, House Bill 242 repeals a piece of the statute that did not require a health insurance provider to reimburse a licensed massage therapist for their services provided in pursuit of treatment. This action brings insurance practices for massage therapy in line with other licensed practices in statute and increases access to massage therapy services for Marylanders who need that treatment to recover from injury or pain by allowing them to pay for those services through insurance. This just is a modernization of standard practice and a recognition of the quality and value of massage therapy as healthcare. For these reasons, I respectfully request a favorable report on House Bill 242.
Good afternoon. Who will be next?
Hello.
Hi, how are you?
I am nervous.
Wonderful.
Madam Chair, esteemed members of the Health and Government Operations Committee, good afternoon. My name is Stephen Conti, licensed massage therapist, small business owner, and secretary of the Board of Massage Therapy Examiners. I thank you for the opportunity to testify in support of House Bill 242, a bill that seeks greater protection of the public safety, health, and well-being of the citizens of Maryland, furthers the mission of the Massage Board and that of this body. This bill has two separate aims, but both are closely intertwined. In the bill under consideration today, we are seeking to remove exclusionary language which specifically precludes treatment from the definition of massage therapy in Section 6101. Massage therapy is currently ordered and accepted as part of the normal treatment plans prescribed by physicians and other healthcare providers under the Health Occupations article. This exclusionary language creates an unnecessary barrier for access to care by citizens of Maryland. In line with the removal of the restrictive language in Section 6101, we are seeking to remove Section 6403 in its entirety. This section specifically restricts licensed massage therapists from receiving third-party reimbursement for medically necessary services. No other health occupation board has this restrictive language. This update does not mandate that third parties must reimburse. Rather, it allows for reimbursement for services rendered within the scope of practice of massage therapy. Removal of Section 6403 ensures all citizens have access to appropriate health care. We are considered licensed healthcare providers as defined by the statute. Additionally, under the Universal Single Payer Health Bill, House Bill 25, the Healthy Maryland program, massage therapy is covered as a medical service. For these reasons, we are asking for a favorable report on this bill. Thank you.
Thank you very much. Next, please.
Thank you, Madam Chair and members of the committee. Good afternoon. My name is Sharon Oliver, and I am the Executive Director of the Massage Board. I'm speaking in support of House Bill 242 today as an individual who has experienced the benefits of massage therapy. A few years ago, I had knee replacement surgery. When physical therapy was insufficient to achieve the desired range of motion goals in a reasonable time frame, my doctor recommended massage therapy to loosen the soft tissue around the prosthetics in both knees. Not only did this treatment modality help increase my mobility, it averted the need for a second surgery, which would have furthered the delay in my recovery. Massage therapy helped to reduce the pain, and in so doing, eliminated the need for tramadol and oxycontin, which are two addictive drugs. And to say that massage therapy is not treatment is a misnomer. Thankfully, my insurance company paid the cost of the therapy treatment, but this is not afforded to all citizens in the state. And as we know, there are great benefits to massage, and as a result of this, I ask that you vote favorably for this bill. Thank you.
Thank you for your time today and your efforts. I'm going to open it up now for questions. Are there any questions for the delegate and her panel? Seeing none, I do have one. There's a letter, an unfavorable letter, delegate, in the file from the League of Life and Health Insurers of Maryland. Have you seen the letter? And can you address it?
Assumes that changing the statute and removing the carve-out creates a mandate. I don't believe that that is accurate. As even said, all we're doing is allowing for this to be a billable service. We are not mandating that it is a billable service.
Okay, thank you. I wonder if contacting the AG's office is, maybe we should do it for clarification for the subcommittee benefit, okay?
Yes, I will do that, Madam Chair. Thank you.
My pleasure. Any other questions? Seeing none, thank you so much for your work.
Thank you.
On this. We do have more witnesses. We have, I'm going to call a couple of people that are favorable. First, Mr. Josh Howe, David Maiden, and Sabrina Lopez. Will you be so kind and come up?
Madam Chair, unfortunately, David Madden couldn't be with us today.
Thank you. You can get started.
Good afternoon, Madam Chair and members of the committee. I'm Josh Howe with Compass Advocacy here on behalf of the American Massage Therapy Association Maryland chapter, or AMTA Maryland, here in strong support of House Bill 242. AMTA would like to thank the delegate for bringing this bill, which addresses two main ideas, which I think she summarized very clearly. First, the bill removed the word treatment under the statute outlining what massage therapy does not include. This is necessary because massage therapists do treat individuals for illness, disease, and injury, including chronic pain relating to the back, neck, and shoulders, but also pain related to fibromyalgia, substance use disorder recovery, and cancer management. The second portion of the bill would remove language from the statute that insulates nonprofit health service plans, insurers, health maintenance organizations, and third-party administrators from providing reimbursement to licensed massage therapists for the services that they provide. Massage therapy is recognized as valid treatment by numerous organizations, including the NIH, American College of Physicians, Federation of State Medical Boards, the Department of Defense, the Veterans Health Administration, and in a consumer survey of at least 50 million American adults, almost 20% have discussed massage therapy treatment with their doctors or healthcare providers. Additionally, there is significant data that shows that massage therapy can be used as a non-opioid alternative to pain management, which could arguably reduce addictions and costs related to it. It's AMTA's position that licensed massage therapists should be reimbursed for services rendered, especially if an individual maintains health insurance and the massage therapy was prescribed by a physician or licensed healthcare provider. And by removing Section 6-403, we believe the bill would bring Marylanders a step closer into getting massage therapy services reimbursed. And for these reasons, we respectfully urge your favorable report.
Thank you for your time today. Excellent time. Can you follow that?
I hope so.
All right, let's
Thank
see.
you, Madam Chair and committee members. My name is Sabrina Lopez. I am a board certified and licensed massage therapist here in Maryland. I am also the Government Relations Chair for the American Massage Therapy Association Maryland chapter. As others had said, massage therapy definitely does provide treatment. We can assist with carpal tunnel. There are plenty of mental health benefits with anxiety, depression, and PTSD, in addition to all of the general muscle soreness and pain that most of us are familiar with. According to a 2021 study, 73% of consumers are receiving massage therapy for health-related reasons. Whether they're discussing that with their doctor or not was not discussed in this particular study. However, of the insurance companies that do cover massage therapy treatment, that is typically paid to chiropractors, physical therapists, and occupational therapists. Those professions are allowed to directly bill for massage therapy services. 27% of insurance companies do require a physician prescription in order for those services to be covered. And 27% of those specifically exclude massage therapists as covered providers. Removing the restricted language in our current legislation would allow massage therapists the opportunity to bill insurances while also not mandating that the insurance company does provide payments. Currently, about 18% of massage therapists are reimbursed by by health insurance. 8 of those are specifically health insurance, 6% or more from auto insurance, 4% of those come from workers' comp. Thank you. We
You can
do
finish
urge
your
a
thought.
favorable report.
I was going to say, you can finish your thought.
That was
Okay.
it. 4% from workers' comp and then 4% from other insurance companies.
Okay, wonderful. Thank you for your testimony today. Are there any witnesses for these two, any questions for these two witnesses? Delegate Gazzoni?
Thank you, Madam Chair. Just a
You're welcome.
quick question, because it seems to be part of the issue. Do we have a sense of how other states are sort of classifying massage therapists in terms of how, particularly for the insurance aspect of this, whether it becomes mandatory, mandated billing or not?
Of the states that are licensed, several, and I'm sorry, I don't know the exact numbers, several are licensed under a Department of Health and listed as healthcare providers. Washington State does have that, and those therapists do receive insurance reimbursement from many plans. Others are listed under different boards, so that may also be a nationwide problem as why we're not being reimbursed as we should.
Great question, because it helps to know what other states are doing as well, right?
Yes.
I don't see any other questions, so I just want to say thank you for coming today. We really appreciate you. And this will actually end the bill hearing on House Bill 242. Next for the committee, we have House Bill 58, which is Delegate Corman. And while he comes up, Delegate Corman, if you have a panel, you can feel free to bring them. The Open Meetings Act, State Ethics Commission, Maryland State Agency Transparency Act of 2023.
We have one person from Common Cause.
Wonderful.
There you are, sorry.
Good afternoon. How are you?
I'm well, how are you?
Good. This is the first time you come to our committee this session, correct?
It is, the new look HGO Committee. Thanks for having me, Madam Chair.
Thank you. We'll have lots of questions for you.
Fantastic. I am State Delegate Mark Corman, here to present HB 58, the Maryland State Transparency Act. If this seems familiar to those of you who are returning members, it's because we've had variations of this bill for various sort of state boards and commissions over the years to apply sort of enhanced transparency rules to them. The most significant in my mind of which is the video streaming of their meetings, but also specific requirements about posting agendas and posting minutes. I will say on the agendas and the minutes, the agency that's the subject to this bill, which is the Maryland State Ethics Commission, already exceeds the standards. The video streaming would be new. I just want to be very clear that this does not change what is sort of a closed meeting option under the Open Meetings Act for the State Ethics Commission. Obviously, they handle lots of sensitive enforcement matters where they go into closed session. That would not change. This would just say the public parts of the meeting the parts of the meeting that you or I could walk into right now, those would be web streamed, but the closed portions, they would not have to have the web streamed on for. And that's true of all the other agencies we've applied this to. They may not have the same level of sensitive closed sessions, but most of our various state boards and commissions have reason to go into closed session, and those are not sort of live streamed requirements. So that's what the bill does. I will note that the Ethics Commission, sort of eyeballing it, about 1/3 of their meetings are public and 2/3 private. I know some people have questions about whether it's worth it because of the fact that some of what they do is enforcement, but I think, you know, an hour of streaming for a 3-hour meeting is still worth doing for public access and transparency. The Commission put a letter of information in asking for an amendment to apply some requirements that we put to other bills to have DoIT assist with the streaming, and so I think that's perfectly appropriate to require that for the commission as well. So I hope that if the committee is interested in the bill, they will take that as well. And let me use my last second to say congratulations, Vice Chair Kelly.
Thank you. Next, please.
Thank you, Delegate Corman, Madam Chair and Vice Chair and members of the committee. My name is Casey Hunter. I'm the Outreach and Engagement Coordinator for Common Cause Maryland, here supporting House Bill 58, which would significantly increase transparency of certain public bodies by enhancing open meeting requirements to make materials and meeting recordings available online. For many Marylanders, attending meetings in person is not accessible, whether that be due to childcare, any health issues, or just simply distance. It's not accessible and is locking them out of these meetings where impactful policies and decisions are being made. The enhanced requirements in HB 58 are easy to implement, inexpensive, widespread, and would vastly increase Marylanders' access to the meetings and meeting materials of state agencies and their public bodies. We strongly urge a favorable report.
And Madam Chair, just note Rebecca Snyder from the Press Association could not be here live today, but you have her written testimony.
Wonderful, because she's the one that I have next. I do want to ask you a question. Did you request the amendment?
I did, and I'll make sure your staff has it, but we do have
You
it.
Thank you. Wonderful. So are there any questions for the delegate and his panel? Delegate Bagnall.
I hit my button by mistake.
Oh, okay, wonderful. We like that. Anyone else? Seeing none? Thank you so much for your testimony today, okay? And if you could work with the subcommittee, you know you're welcome. Thank you.
Thank you.
So basically, this ends the House Bill, the hearing on House Bill 58. So for the committee, our next bill will be House Bill 234. Delegate Taveras, will you please go and give us your testimony and bring your panel if you have one? And that is the State Board of Chiropractic Examiners Disciplinary Actions. Delegate Taveras, House Bill 234. And while she comes up, may I have Sharon Oliver and Karen Monter? Will you please come up and sit with the delegate? As soon as the delegate sits, she'll start her testimony. Good afternoon, Delegate Taveras. Will you be so kind and get started?
Yes. Ooh, nice. Okay, thank you, Chair Peña-Melnick, Vice Chair Kelly, soon to be Senator Kelly, and committee members. It is an honor to testify before you today to ask for your favorable recommendation for HB 234 with the requested amendment that should be in your packet. The Maryland State Board of Chiropractic Examiners is requesting the creation of a mechanism to reinstate chiropractors that have had their license revoked or suspended due to malfeasance. This is basically a good governance bill that provides professionals with a due process to request reinstatements of licensure under certain conditions with board approval and under board oversight. If the board so deems that an individual has come back into compliance. This process does not currently exist in the law, and this bill would serve as a course correction. The Maryland Chiropractic Association is requesting an amendment that has been considered and accepted by the Board of Chiropractic Examiners. The amendment is included in your floor packet, and we ask that it also be approved. I humbly ask that this committee please provide a favorable report to HB 234 with the requested amendment. Let's give those individuals that the Board of Chiropractic Examiners believes has seen an error in their ways a second chance to practice in the chiropractic field. Thank you.
Excellent testimony, Delegate. You did very well. Who will be next?
I will be. Good afternoon again. I am Sharon Oliver, and I'm the Executive Director for the Chiropractic Board as well as the Massage Therapy Boards. And I thank you for the opportunity to testify in support of House Bill 234. This is a bill that seeks to further the mission of the board and this body, that of protecting
Can you tell us your name again for the record, please?
Sharon Oliver.
Thank you.
And this is a bill that seeks to further the mission of the board and this body, that of protecting the public health, safety, and well-being of the citizens of Maryland. The bill under consideration today has three distinctive elements. First, a provision prohibiting the stay of a final order revoking or suspending the license of an individual for egregious acts or blatant violation of board statute or regulation. It is imperative for the board in its regulatory role to be able to ensure that practitioners who are found to be a threat to the safety and well-being of the public not be allowed to continue the practice of chiropractic during the judicial review process. Many other boards have this provision in their law, and it would only apply to the worst of the cases at a time, as most of the time the board attempts to settle cases with the practitioner through consent orders. A second element, as mentioned before, is to grant the board the authority to impose additional sanctions when someone is in violation of their consent order and negotiated order. And the third element is a goodwill provision that provides a clear pathway to individuals to re-enter the workforce after they have been rehabilitated and demonstrate that they are ready for the workforce. For these reasons, we ask for a favorable vote on House Bill 234. Thank you.
Thank you. Next, please.
Good afternoon, Madam Chair, Madam Vice Chair, and esteemed members of the committee. Thank you, Delegate Taveras, for sponsoring this bill. My name is Karen Riley Munter. I'm a practicing bachelor's prepared registered nurse and consumer member of the Maryland State Board of Chiropractic Examiners, and I appreciate the opportunity to testify in support of House Bill 234. As a consumer member and healthcare provider, I have a keen interest in the welfare of others. Bill 234 regards disciplinary actions and the board's role in keeping the public safe, as Ms. Oliver has already described. In the interest of public safety, the board does review and investigate any and all complaints of untoward actions by our licensees. Some actions of the licensees, if allowed to continue, could very well harm the public. It is our duty to oversee these licensees, create very clear regulations, and when necessary, intervene. This bill clarifies for the licensees their responsibilities if sanctioned, and includes a clearer path to rejoining the profession after rehabilitation with the goodwill provision. We're asking for a favorable vote on these provisions as annotated in House Bill 234. Thank you very much for your time.
Thank you for your testimony today. Are there any questions for the sponsor and her witnesses? Seeing none, thank you. Great work. Oh, there is? All right, Delegate Hill, I did not see the light.
Yeah, sorry. You saw the light. You
I
didn't
always
see the light.
I did not see the light,
didn't see my
but
light.
you have to be careful because I'll give it back. Go ahead.
Thank you, Madam Chair. I guess this is either for Ms. Oliver or Delegate Tavares. Do other boards have the authority to reinstate licensees that they have removed the license from?
Yes, they do.
Okay, thank you.
Any other lights out there? Woo, all right, thank you very much. We really appreciate your testimony, and thank you for working with the delegate. We do have a favorable with amendment, and that's Delegate Taveras, if you could, you can stay there, actually. Ashley Bagwell, you have a favorable with amendment. How are you?
I'm good. How
Good
are you?
afternoon. I'm doing well.
Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. I'm Ashley Bagwell, here this afternoon on behalf of the Maryland Chiropractic Association in support of House Bill 324 with amendments, and this is the amendment that Delegate Taveras outlined at the onset when she introduced the bill. We appreciate the board working with us on this language, and we are in support with the language that has been offered by the sponsor.
We love that short testimony. Thank you.
I love giving short testimony.
Thank you. Any questions? Seeing none, thank you both. We really appreciate
Thank
it.
you.
And this actually concludes the testimony on House Bill 234. Delegate Taveras, you could stay there because you have House Bill 238, massage therapy definition and discipline. And while your panel comes out, will you get started with the testimony, please? Actually, hold on a second. I'd like to get Stephen Conti, Sharon Oliver, and Sabrina Lopez, if you can come up and join the delegate. You can get started.
Thank you. Okay, Mr. Conti's on his way.
Okay, you can get
Okay.
started. You can get started.
Okay. Again, everyone, thank you. It may sound a little redundant, but because it's a little similar. Thank you, Chair Peña-Melnick and Vice Chair Kelly, again, and the committee members. It is an honor, again, to be before you, or I guess not to have moved, and to ask for your favorable recommendation for HB 238. The Maryland State Board of Massage Therapists is requesting the expansion of the definition of massage therapist to include individuals that are conducting massages without compensation, and for the creation of a mechanism to reinstate massage therapists that have had their licenses revoked or suspended due to malfeasance, similar to the previous bill. This, too, is a good governance bill that provides professionals with a due process for their licensure reinstatement under certain conditions with board approval and under board oversight. If the board, again, so deems that an individual has come back into compliance. Again, this process does not exist in the current law, and this would be a course correction to the previous act that currently is in the books. I humbly request that this committee provide a favorable report on HB 238, and this also gives the individuals that are overseen by the Board of Massage Therapists a chance to come back and a second chance to practice in their respective field if the board so decides. So thank you so much for listening and for your favorable report in your consideration for this bill.
Next, we have Ms. Sharon Oliver. While you speak, Ms. Sabrina Lopez, can you come and join the panel, please? Thank you.
Thank you. Again, I'm Sharon Oliver, and I am the Executive Director for the Massage Therapy Board. In support of House Bill 238, again, this is a bill that seeks to protect the public. And as mentioned previously, one provision of this bill is to stay the order. Is to prohibit the staying of a final order when someone has been disciplined, revoked, or suspended. We deem that it is very important for the board to be able to protect the public and not allow a massage therapist who has been revoked to continue the practice of massage therapy during the appeals process. As recently as last year, we had an individual who violated one of their clients and crossed professional boundaries, request a stay of his order, and it would have been a bit troubling for us if that individual was allowed to continue to practice massage therapy. If you think about how massage is done and the fact that individuals are in a prone position and that they are at the mercy of the person who is providing the treatment, we want to ensure that this does not happen during a judicial review. Again, a second element is to impose additional sanctions in the event that someone willfully violates the terms and conditions of a negotiated order. For these reasons, we ask for a favorable vote on this bill. Thank you.
Thank you. Next, please.
Good afternoon, Madam Chair, members of the Government Operations Committee. Again, my name is Stephen Conti, licensed massage therapist, small business owner, and the Secretary of the Board of Massage Therapy Examiners. As my colleague, Ms. Oliver, mentioned, there are four elements of this bill. I'm going to cover the next few. This bill includes a goodwill provision that clearly defines a pathway to reentry into the workforce after board discipline. The board recognizes that individuals can be rehabilitated and returned to the workforce as productive citizens. This bill also closes a loophole to include oversight of individuals who practice massage therapy without a license. The definition of the practice massage therapy was changed to with or without compensation. This broadens protection of the public. Finally, we ask that the law requiring publication of board disciplinary orders in the Maryland Register be repealed. This is an archaic provision of the law, as most members of the public do not read the Maryland Register. The board publishes disciplinary orders on its website and reports each action to the National Practitioners Data Bank, a repository available to all state licensing boards and credentialing agencies. Publication in the Maryland Register is duplicative at best and a less effective means to ensure that the public is aware of the board's orders. For these reasons, we ask for a favorable report on this bill. Thank you.
Next.
Thank you, Madam Chair, committee members. Again, my name is Sabrina Lopez. I am a board certified and licensed massage therapist. I am here representing the American Massage Therapy Association Maryland chapter as their government relations chair. This bill serves to protect the public from untrained individuals performing massage and illegal activities that happen under the disguise of massage therapy. It also protects the public by making it easier for law enforcement to identify and confront illegal practice of massage therapy. Some individuals have been using the healthcare profession of therapeutic massage to hide sexually oriented businesses, and others have lost their license and still continue to practice illegally. This bill will protect the massage therapy profession, thus protecting the public from both unlicensed individuals performing massage and businesses offering illegal services under the guise of massage. A 2004 study showed that those receiving massage were unable to differentiate whether their therapist was trained or untrained in massage therapy. Dr. Whippenagel concluded that the research revealed that those subjects were exposed to an increased risk of harm due to the therapist's lack of knowledge. Therefore, I believe it is important that we have stricter language with the massage therapy definition to include with or without compensation, because the compensation does not negate the fact that massage therapy was performed and put someone at risk for adverse effects from that massage therapy service. Therefore, we ask for your favorable report for HB 238. Thank you.
Thank you for your testimony. Are there any questions? Delegate Kelly. Vice Chair Kelly, followed by Delegate Hill.
Thank you so much. And this is just, I guess, a clarification, so I'll direct it to Ms. Oliver, although whoever has the best answer can answer, I guess. Who would be professionally performing massage therapy without compensation? In what circumstances? What population are we trying to target? It's not my husband, right? It's
No.
not, if Delegate Charkoudian wanted
No.
to give me a massage, she doesn't fall under this. Sorry.
No.
I'm just, she's nice, I don't know.
No, that's not the group that is being, quote, targeted. We do have in the law a provision where if massage is performed for friends and family, those individuals are excluded. So we don't target, or students. So these are individuals, and sometimes we have licensed individuals from another state who may come into our state and perform massage and could cause injury and claim that because they were not being compensated, we have no jurisdiction over them because of the way the law is written.
Free massages? I'm just confused. Why are they doing massages? Is there something happening?
we don't know, but we have had instances where individuals, it has come to the attention of the board that there are individuals who have performed massages at parties or to not just their friends and family, but individuals who are attending these parties. And we have no legal standing against these individuals.
So this is in, I'm sorry, Madam Chair, one follow-up? Sure. So this is in response to complaints you've received
Yes,
and you haven't
yes.
had authority, and so.
That's correct.
And you don't believe that the language as you propose it would impact friends or family or
No.
people who have an individual relationship
No.
with someone?
I
Okay,
mean,
thank you.
we're not out there targeting individuals, and we're a complaint-driven board. And unless a matter is brought to our attention, we would not be investigating.
Thank you very much.
You're so welcome.
And thank you for everything. I've really enjoyed working with you.
Same here, thank you.
Thank you, Vice Chair Kelly. Next, we have Delegate Hill.
Thank you, Madam Chair. I'm actually, I guess this is a follow-up of Vice Chair Kelly's question. I understand that, and what you said is we would not go after. I'm looking for the language that makes it clear that if Delegate Morgan told you that I hurt his shoulder when I gave him a massage as I was going around the desk, you got a complaint that my hands were too strong, that I don't see where you wouldn't investigate me.
If we receive a complaint, the board is complaint-driven. So until we receive a complaint, a written complaint, we have no way of investigating or initiating an investigation.
Thank you. I have any other questions? Delegate Bandari.
Thank you, Madam Chair. I'm looking the fiscal notes, and as a penalty, it says for a first offense, a fine up to $2,000 and imprisonment for up to 6 months. For a subsequent offense, a fine of $6,000 and imprisonment for up to 1 year. So would you walk me through, to get a 1 year and 6,000 imprisonment, what that person or that business has to do to get to that extreme? I'm looking the fiscal notes.
That's the law that's on the books now. So if we've had instances where an individual has a license with the board, they have not renewed their license, and they have continued to practice massage therapy under the code expired or non-renewed license. The board, that provision gives the board the authority to impose fine, or if it's done in the civil court, those fines can be levied against the individuals. We're talking, the first part of the law that we were talking about, the provision here, is for someone who had never been licensed by the board. So we're dealing with two different individuals, someone who was licensed by the board and failed to renew their license and continue the practice of massage therapy. We have jurisdiction over that license number still.
And any other questions? Delegate Collison?
Thank you, Madam Chair. So I went back and forth because my questions were sort of related to the vice chairs and Delegate Hills. But how often does this happen? How prevalent is it that you get complaints about folks who are offering these services without being compensated?
You would be surprised. We have had, I would say in the last 2 months alone, 5 complaints of individuals who are practicing without a license. 5 or 6 complaints.
And if,
most of these were compensated.
can I speak to?
No, you wait for a question, okay? You want to follow up? Okay. Delegate Taveras.
No, I just wanted to share that we do have a report for all malfeasance that's occurred over the last 10 years, and there is an average of about 3.5 per year, in addition to the fact that in total, over the last 10 years, been 75 cases, and we're really talking about a 2.1% either revoked or suspended license out of 1,972 licensees.
Okay. Any other questions? Delegate Bagnall.
Thank you, Madam Chair. I think we're all trying to sort of get to the same place. Is this a tool that you need because when you've gotten these complaints, you don't actually have a mechanism to investigate and discipline because their claim is that they're uncompensated and therefore it's not in your jurisdiction?
That is correct.
So you need the
We need the tool to be able-
uncompensated within
we need
your
the
tools
tool.
in order to do your oversight. Is that correct?
That's correct.
Okay, thank you. Thank you, Madam Chair.
You're welcome. And I do have a question, Delegate Taveras. There was an amendment that was sought in House Bill 234 from Ms. Batwell, and that amendment should probably be sought in this bill as well. So just putting it on your radar. I will, if this bill is assigned to subcommittee, it will go to Health Occupations and Long-Term Care, who the Vice Chair is Delegate Rosenberg, so you can dig deeper into this, make sure that you come to the subcommittee when it's assigned and you're able to explain it further. Okay?
Yes.
Not a problem. We could share the data on the egregious that the board, cases that the board sees.
Right. I mean, the bottom line is that presently you are complaint driven. When there's a complaint, which you have anywhere from 3 to 5 a year, you're not able to do anything because you don't have the tools. So this is a tool for you to be able to investigate. And the fines that apply here that are in the fiscal note are the same fine that the law right now prescribes, correct?
That's correct.
Thank you. There are no other witnesses and there are no other questions. So thank you for being here with us and for your patience. And this concludes the bill hearing on House Bill 238. Delegate Taveras, you did quite well for your first bills.
Thank you, everyone.
My pleasure. Next we have, this concludes the bill hearing on House Bill 238. We have next for the committee. We're doing quite well with time. We have House Bill 230, House Bill 63. We have Delegate Cherkoudian, Certified Local Farm and Chesapeake Invasive Species Provider Program Establishment. Will you come out with your panel, please?
Thank you. Yes, Madam Chair, can my panel join me? I think you're info, so you're not on the panel.
Delegate Crosby, you will be next after Delegate Cherkoudian, so you could tell her to be quick. Just kidding. Good afternoon, everyone.
Good afternoon, Madam Chair, Madam Vice Chair. I wanted one more time in front of you. Delegate Lori Cherkoudian, for the record, here asking for a favorable report on House Bill 63. For those of you who are on HGO or in the General Assembly, in previous years, we did some really good work in Maryland. This is a procurement bill. We did some really good work in Maryland to structure our procurement to support our state institutions to buy more Maryland-grown food. Really to support the farms and farming in Maryland, and there's a whole process that we developed to do that, and it's actually creative and sort of a national model. And I'm happy to talk about that background at any point with anyone who wants to hear more about that. What this bill does is it adds to that. So our procurement process requires that all of our state institutions attempt to get 20% of their food that they're purchasing from Maryland, essentially local farms, and requires that all of the procurement that's done show that there was an attempt to engage with a certified local farmer. So we have the 20% piece, we have grant programs for aggregation and sales to the state institutions. And what this bill does is it adds to that. What it adds is Chesapeake Bay invasive species.
So as it turns out, blue catfish in particular, which you'll hear about from our panel, but invasive species in general can be quite delicious. So even though they're causing huge harm to our bay, they apparently taste good and they're very nutritious. And so what this bill does is it creates essentially a pathway for folks to pull those invasive species out of our bay, right, incentivizing taking care of a huge problem in the Chesapeake Bay, and then serve them getting good nutrition and tasty food into schools and our state institutions. So that's the crux of what this bill does, and folks on my panel can talk more about why that's important and what that'll do for our economy and for our bay, and then we'll take questions.
I have Ms. Amanda Beth Brewster.
Was that? You want to start over there?
Sure. Madam Chair, members of the committee, my name is Mark Powell. I'm Chief of Marketing for the Maryland Department of Agriculture. Department of Agriculture very much supports the passage of this legislation. We run the Certified Local Farm Enterprise Program. In its early stages, it shows great promise, and we are very excited for that program. Adding blue catfish will be fairly significant. It'll be fairly significant progress for the state. We market blue catfish through our seafood marketing program in a number of ways. Since 2017, we have reached 90,000 consumers directly with sampling of blue catfish, with chefs, that sort of thing. We are working currently with the Maryland Public Television to do a documentary to, again, explain to consumers the value of eating blue catfish and also the fact that it is a wonderfully tasty fish, as hopefully you guys will find out soon. We continue to work through advertising and promotions statewide to promote blue catfish and also regionally. We have spent something in the order of $230,000 thus far promoting blue catfish. And we most recently issued a $500,000 grant to the Maryland Food Bank to purchase blue catfish for those in need so they can share in this great fish. So just once again, I strongly encourage you to support this legislation. It will create a new market for our Maryland watermen and our seafood processors, and it will expose more Marylanders to this tasty fish and remove an invasive species. Thank you.
Thank you for your time today. Who will be next?
Thank you, Madam Chair. My name is Steve McHenry. I serve as Director of the Maryland Agricultural and Resource-Based Industry Development Corporation, much better known by the acronym MARBIDCO. We are essentially the state's economic development finance agency for agriculture, forestry, and the seafood industries in Maryland. So we very much want to commend Delegate Charkoudian for her leadership on this issue. We've been spending a lot of time at MARBIDCO contemplating ways to help get more blue catfish out of the bay and processed into the mouths of people. And we recently wrote a sizable USDA grant, which we don't know the results of, but this is something we're really very much focused on. The other reason why I'm here today is we actually administer the Certified Local Farm Enterprise Aggregation Grant Program. So we actually have funding in the budget for such an activity if it were authorized. And so we're receiving about $435,000 annually, and we have funding available for 2 more fiscal years under the statute. So with the passage of this legislation, we'll be able to make grants to seafood processors if they're intending to sell those catfish products into institutional or wholesale markets. So we very much strongly encourage you to support the passage of this bill, and we might actually ask you to accelerate the effective date of this bill from October 1st to July 1st so that we might get that funding out more quickly, assuming this legislation is passed. Thank you very much for your support.
Thank you. Who's next?
So, good afternoon, Madam Chair, members of the committee. I'm Charlotte Davis. I'm the Executive Director of the Rural Maryland Council. We are an independent state agency located in the Maryland Department of Agriculture, And our mission is that we bring together diverse stakeholders to identify the challenges in rural Maryland. We support and look to develop our rural economies. Agriculture, aquaculture, and resource-based industries are an important part of that. And we believe the passage of this bill will help create new markets for this invasive species. And we look to, support that rural economic development, particularly for our watermen. We want to see the procurement and the 20% goal and have that blue catfish be a part of that, including accessing the Marbidco program. So, and if I could put a shameless plug in, we are going to be distributing samples of blue catfish at our Maryland Day event on March 24th in Lawyers Mall. And so save the date and please come out and enjoy this tasty bounty of the Chesapeake Bay. So please support House Bill 63. Thank you.
Our pleasure. Who's next?
Good afternoon. My name is Beth Brewster. I am the founder and director of Chesapeake Culinary Center, a nonprofit organization in Caroline County. I'm also the Caroline County Public Schools Food Service Director. I'm about feeding people. That's what I do. As we know, it's important to have a thriving local food economy. We feel the addition to Chesapeake invasive species to the Certified Local Farm Program will help institutions meet or exceed the purchasing of 20% of locally sourced food. Institutionalized food service operations often struggle with procuring local foods due to not having the labor, nor the skill set of the staff to process the produce that comes in. If fish comes in, it's going to be much easier to prepare and put on a pan and to serve to people. Quite often it needs to come in ready to serve to us before we can get it out. Adding another source that can easily be served will assist with the procurement of local products. By adding the Chesapeake invasive species, it will include protein source that is harvested locally and to help create a market for our delicious but invasive species in our tributaries. By creating a market demand, it will allow our watermen to diversify their catch and help to reduce the number of invasives in our tributaries that are causing havoc on this ecosystem. Seafood is often overlooked in the food access plan, and for Maryland is an abundant protein source. In particular, the blue catfish is overtaking our waterways and is truly one of the most sustainable fish in America. So if no one has heard about the blue catfish, please look. It really is doing havoc on our ecosystem. It can grow up to 100 pounds and live 20 years. I thank you for your time on this matter. I hope you will find favorable report for House Bill 63. This bill will assist in moving forward with our food resilient in Maryland. Thank you for your time.
Next, please.
Good afternoon, Madam Chair, members of the committee. My name is Allison Colden. I'm a senior fisheries scientist with the Chesapeake Bay Foundation, and I'm pleased to be here today in support of House Bill 63. As has been mentioned before, the blue catfish is an invasive species to the Chesapeake Bay. It was introduced in the 1970s and 80s to develop a recreational fishery, but since that time has invaded nearly every river and tributary in the Chesapeake Bay watershed. As mentioned, it wreaks havoc on our ecosystems. It both outcompetes and directly preys upon our native species, including striped bass and blue crabs, which in last year's survey developed by the Department of Natural Resources were at the lowest in their 33-year time series of data. So we're very concerned about the impacts that this species is having on our Chesapeake Bay ecosystem. This would include House Bill 63 would increase the market demand for blue catfish by developing that 20% goal or feeding into that 20% goal. And that is one of the main management recommendations coming out of the Chesapeake Bay program's invasive catfish task force on which I serve. So this increased market demand would help induce more harvest of this species, removing it from the Chesapeake Bay, and as has been mentioned, providing a great protein source for Marylanders straight from the Chesapeake Bay. So I urge your favorable report. Thank you.
Thank you for being here today and for the work that you're doing. We're now going to open it up for questions, and the first questions we have is Delegate Kipke, followed by Delegate Chisholm, followed by Delegate Hutchinson.
Thank you, Madam Chairman. Beth, you fed me this fish over on the shore last year, and I agree it's very tasty. You had also scared me thinking about what impact this fish might do on the overall ecosystem of the bay, so I appreciate the bill. I'm curious, though, in the bill, on I think the third page, it speaks to how you get on the list to be an invasive species. So can anybody there educate me on where I find the list of those fish, and I'm curious, does it include like the snakehead fish, which is being served up in seafood restaurants in my district now?
I'm happy to answer that question. So the bill specifies it's species that are listed as high priority in the, let me get this right, Maryland Aquatic Nuisance Species Management Plan. That's a management plan developed by DNR and maintained by DNR. It does include the northern snakehead, which is another species, as well as the flathead catfish. So that's another invasive catfish species. And this would also allow, if there were, hopefully not, knock on wood, any other invasive species introduced in the Chesapeake Bay that could be listed in this plan, this would allow them to automatically sort of fall under that category as well and allow them to be harvested along with the 3 species that I mentioned.
Thank you.
Delegate Chisholm.
Thank you, Madam Chair. And since Delegate Kipke and I share the same river, I think we both were on the same thing when you started speaking about this, because the snakehead really has wreaked havoc on the crab population around this. And, you know, Delegate Charkoudian, you're not going to hear this from me very often, but I love this bill. And I am glad to hear that the snakehead's on there, because they are growing, and they grow fast. You can see them at night. There are people actually around us in the Severn River and the Magothy River. They just put a light down, and it looks like you can walk across those fish. So I appreciate the bill, and I'm glad to hear that the snakehead's on there. So thank you. Thank you, Madam Chair.
My pleasure. Delegate Hutchinson.
Thank you, Madam Chair.
Yeah.
Is it? No. Hold on a second. Go ahead. All right.
Thank you, Madam Chair.
We are having some technical difficulties. It's okay. Go ahead.
I equally love this bill as well, especially being from the Eastern Shore, supporting our watermen. I'm well aware of the magnitude of what the blue catfish is doing. And it is very tasty, as well as snakehead too, which I want to someday rename as the blackwater bass, but that's a better marketing name for it. That's a later bill. Aren't there some FDA issues in terms of the inspection requirements for the processors that we have to overcome to really make the processing sufficient? And where are we with that issue?
Thank you. I think Steve's got that answer. Is that all right?
Sure. Yes. Interestingly enough, all of your red meat animals that are processed, as well as large numbers of poultry products, have to be processed at USDA inspected facilities. Congress, as part of one of the more recent farm bills, in order to protect catfish farmers in Louisiana and thereabouts, put a requirement into law that all catfish species would also have to be USDA inspected. That's not typical of other fish species. So that's an incredible impediment to folks wanting to, process catfish in Maryland. So that's one of the reasons why we've been spending so much time trying to figure out how to find resources so that seafood processors who want to process blue catfish can do so in a way that makes sense. So that's sort of the federal impediment to processing blue catfish right now in Maryland. I understand our congressional delegation is trying to convince Congress in the next farm bill, which is being worked on this year, is trying to do away with that requirement. But right now, federal law requires blue catfish to be federally USDA inspected when those fish are being processed.
Any other questions? Seeing none, thank you very much.
Thank you.
For your testimony today. And for the committee members, don't touch the button. Let staff try to figure it out, and it makes it easier for her. And let's see if that works, okay? Thank you. And thank you very much. I know it's not easy, Maricruz. Thank you. So we have Allison Colden from the Chesapeake Bay. That was you? All right, wonderful. We have David Nemasi from the University of Maryland.
Thank you.
How are you today?
Thank you. Thank you, Madam Chair. My name is Dave Namazi, and I'm the Chief of Staff at the University of Maryland Center for Environmental Science. And I appreciate the opportunity to talk to you today on background for HB 63. As you've heard before, and I won't repeat some of that same testimony, but I will touch on a couple points. One, the blue catfish has become a dominant fish species in much of the tidal fresh areas of the principal tributaries in the Chesapeake Bay. As an example of their hyperabundance, this isn't just abundance, this is hyperabundance. In one study, 1.6 million blue catfish were found in a 7-mile stretch of a river. And they are voracious eaters of many of our key species, such as striped bass, American shad, Atlantic sturgeon, and possibly having an impact on blue crabs. There is no obvious fix to this dominant role, but for human consumption at this point. I would also touch on the fact that the problem related to the fish processing is significant, and we do hope that there is some relief to that soon. There's about $1 million in value right now for that fishery, but we know there's a lot of room for expansion. Finally, on the snakehead, northern snakehead fish, which is also mentioned, they have been expanding rapidly as well. They are also voracious predators, as mentioned. There's a very passionate recreational angling or recreational fishery, but not so much of a commercial fishery. And so that can be, hopefully that could be expanded as well. So there's plenty of room to increase fishing pressure on these two invasive species, thus relieving the pressure on native species. Therefore, programs such as discussed in HB 63 is a win for the environment. Thank you very much, and I'll happy to stay for any questions.
Thank you for making time to come to the committee and offering your expertise. We appreciate it. Are there any questions for this witness? Seeing none, thank you so much. You did a great job. There are no questions. Oh, you do have one? Okay, wonderful. I tell you, I have to show that light.
I did.
Go ahead.
Thank you, Madam Chair. I have a question. You mentioned the snakehead population.
Yes.
It was my understanding that we thought that they would decimate the striped bass population. However, wait till finish. However, I'm hearing now that that's not happening, that they actually both go after the same food resource. So can you speak on that for us?
Yeah, I think there is a little bit of, there is some niche separation that has taken place. However, they are still pretty significant predators of other fish, and some of the fish that striped bass would also eat. So in essence, while they may not be eating each other as much, they are still going after the same fish. One of the big differences is that snakeheads currently seem to be better confined in freshwater to low brackish waters, which is a little bit different than the blue catfish, which has been able to emerge into some higher salinity waters, moving further down the tributaries, causing more of a competition and or predation pressures.
My pleasure. I don't see any other lights. Thank you for coming, okay?
Thank you.
Thank you. This actually concludes the bill hearing on House Bill 63. Thank you, Delegate Charkoudian. Next, we have House Bill 165, Delegate Crosby. I understand you do not have a panel, am I right?
I do not. Army of one.
All right.
Yeah,
Go
it should
ahead,
be
let's,
relatively quick.
wonderful.
Good afternoon, Madam Chair, Madam Vice Chair. Congratulations publicly.
One second, 1 minute. Sir, you have
sorry.
to sit down. Thank you. Go ahead.
Oh.
Thank you. Go ahead.
Good afternoon, Madam Chair, Madam Vice Chair. Congratulations again, and members of the committee. For the record, Delegate Brian Crosby here on House Bill 165, General Provision, Standard Time, year-round daylight savings time. This is the third straight year I've brought the bill, and the bill is in the exact same form it passed out of the House the last 2 years. All it simply says is two components. Maryland will go to year-round daylight saving time if the federal government amends the Uniform Time Code, which has not happened. It passed out of the Senate 2 years ago. And all the surrounding jurisdictions also adopt the same measure. Currently, only one of those jurisdictions, I believe it's Delaware, has this. There are proposals in other states, but if the trend and the movement goes that way, we just want to make sure that we are on the same time zone as everybody else. To be completely honest, I just want my clock to stop changing. That's it. It drives me nuts, and frankly, the statistics are pretty overwhelming. And it is somewhat of a public health crisis, I think, that the 2 years or the 2 weeks following the time change, suicides, miscarriages, heart attacks, strokes are all up. Car accidents are up, and they seem to really be related to your circadian rhythm and your internal clock, and they are the most dangerous times of the year. And that's the whole impetus behind the bill. I can tell you there are going to obviously be proponents for standard time versus daylight saving time. I brought the bill in as permanent daylight saving time just because it seems like the overwhelming majority of people agree with that. And I think that there are polls. The last one I viewed was CBS, where it's over 50% of people agreed with daylight saving time. 30% were about standard time, and then I would really like to meet the 20% of people who like to go back and forth, but they were the remainder. When I first brought it in, the committee took kind of a straw poll, and it seemed to also go with permanent daylight saving time, overwhelmingly, probably more so than any of the polls. The benefits to daylight saving time year-round, generally a little bit more of a healthier population because there's more sunlight in the afternoon, so more people work out. It is more pro-business because there's more time to shop and people like to be out and about, especially in hours of sunlight. They can walk to the stores, and there is a reduction in crime with the more sunlight. So. For those reasons, I urge the committee for a favorable report.
Thank you for being with us again. We appreciate it. Are there any questions for the delegate? Seeing none. Thank you.
Thank you.
We do have some witnesses. We have a favorable from Mr. Matthew Ribel.
Yes.
Yes, how are you? You can come and sit. How are you today?
Yeah, I am doing fine. I agree with what Crosby just said. And who just spoke? Crosby?
Yeah, Delegate Crosby, yes.
And the House Bill 165.
Yes.
I'm Matt Ribel, and I do realize there have been countless studies over the past 20, 30 years showing the dangers of the springing forward. There's heart attacks, and there's a lot of heart attacks, up 25%. There's a 10% jump in car accidents, and students do a lot worse on their tests in school. And we have judges hand out harsher sentences, and work productivity is lower because employees are more tired. And in the fall change, it seems that it's easier to adjust, but there's not enough benefit to offset what happens in the springtime change. And I also hate the argument that the people from Start School Later give against daylight savings time year-round, because I think that there's going to be the same issue with Start School Later, balancing what the parents want for family activities and what's best for them biologically. Maybe on permanent standard time, adults would be ready to start work at 8 a.m. and would want their children start in high school at 7:30, and Start School Later would recommend they start at 9. But on permanent daylight saving, maybe adults would be ready for work at 9, and they'd want their children start in high school at 8:30, and Start School Later will recommend start at 10. So we have the same amount of imbalance, no matter how we label the hours on the clock. So I do not see permanent daylight saving in the long run as a problem for Start School Later.
Thank you, thank you. Let me see if there are some questions for you. 1 second, are there any questions? Seeing none, thank you for coming today. We really appreciate hearing from you.
You're welcome.
And we'll take what you said into consideration when we make a decision, okay?
Okay.
Thank you. Next, we have Ms. Lisa Van Varskert from Star School Later. You have to sit down, sir. Thank you so much.
Good afternoon, Chair Pena-Melnick, Vice Chair Kelly, and members of the Health and Government Operations Committee. I'm Lisa Van Buskirk of Start School Later, Maryland. This is my 4th year testifying in opposition to permanent daylight savings time. This year it's House Bill 165. My written comments are longer and include a number of enclosures that I hope you will review. What is the difference between permanent daylight savings time versus status quo or permanent standard time? It's the difference between sunrise on the opening day of the Maryland General Assembly being at 8:24 in the morning versus 7:24 in the morning if you were coming to work at 7:30. Today's sunrise was at 6:57, a month into session, and the daylight is already increasing in the morning and evening, but under permanent daylight savings time, sunrise would barely be before 8 a.m. Permanent daylight savings time combined with the current 2 early school start times would have an even greater negative impact on adolescent circadian rhythm, safety, health, and academics. It is contrary to the intent of previous state legislation regarding school bell times, including 2014's House Bill 883, 2016's House Bill 39, both of which were sponsored by now new Lieutenant Governor Aruna Miller. This school year, Anne Arundel County implemented new school hours aligned with expert recommendations. Next week, Howard County's Board of Education will vote on new school start and end times. This bill would negate both efforts, which are nearly 30 years in the making, which is why MABE and AACPS opposed DST legislation previously. Under daylight savings times, more Maryland students of all ages would walk or wait for buses in the dark. Please see my enclosure listing all of the school systems with schools starting before sunrise at all levels. House Bill 165 requires adjacent states to also pass permanent daylight savings time legislation. Last month, Virginia's Senate defeated a permanent daylight savings time bill. Please vote for an unfavorable report on House Bill 165, amend the bill to permanent standard time, or amend the bill to include a mandate for minimum safe, healthy, and age-appropriate start times for all students. Thank you.
Thank you. Are there any questions for this witness? We have Delegate Hill.
Thank you. And I really appreciate the chance to ask you a question because I've been listening to Senate hearings, down in Washington and these hearings for a while. I don't see where the time we start our workday or school day is locked to anything. So if we adopt a standard, regardless of which one, if it's too early when we go to work or whatever, won't we just change that? So for instance, the average workday in Chicago's starts at 8 because they want to be on time with what we're doing on the East Coast. So they don't go 9 to 5, they go 8 to 4. So why wouldn't we just adjust the time school starts to the work starts to go with so we get enough sunshine?
Sure, and I would be fine with that. Other than my experience, I've been the chapter leader for Start School Later since 2015. And so Anne Arundel County took 30 years to make this decision to change start times. So because it's all an issue of local control, unless you actually include a mandate to change start times, I think the school systems will not actually act on that. Because they already have students going at unsafe hours in the dark as it is. So unless there's a groundswell of opposition from parents about the number of students in the dark and forcing them to change school start times, then that would be fine. But I don't see that happening, in my opinion.
Thank you.
Delegate Johnson.
Thank you, Madam Chair.
You're welcome.
Thank you, Madam Chair. And thank you for coming today.
It's, why she went to the back to get something for my throat, so you can go ahead and ask it. We can hear you.
Do you have any statistics on how many accidents there are for school students going to work
Or going to school in the dark hours?
Well, I do know in 1974, when we did change to permanent daylight savings times, within the first month, there were several deaths of students that were blamed on the dark early morning hours. But as far as current statistics, I do not.
Thank you. Thank you, Madam Chair.
Thank you. Any other questions?
Thank you for your time.
I don't see any. Thank you for your time. I have Mr. James Crabtree. I also have JP and Jens Christian. Will you all come up, please? You can get started.
Dear members of the Health and Government Operations Committee, thank you for allowing me the opportunity to testify against House Bill 165. I'm James Crabtree, a Maryland resident and volunteer for Save Standard Time. On the darkest days of the year, the temptation of more time to spend in the sun can be challenging to resist. And in 1973, as the United States faced an energy crisis, federal lawmakers were enticed by the promise of brighter evenings and passed the same policy of permanent daylight saving time that Maryland is now considering. Then the first Monday of 1974 came and the sun rose at 8:25 a.m. in Annapolis. Jet blackness, as one mother described the scene at her daughter's bus stop, engulfed the nation until long after morning commuters had departed for work or school. While standard time was not due to return until October 1975, the failed experiment was ended 1 year early to spare citizens a second consecutive winter of morning misery. Scientists warn that exposure to excess evening sunlight and insufficient morning sunlight chronically worsens health, public safety, and the economy. Similarly, experts advise that humans operate ideally when the center of daylight hours roughly corresponds with civil noon, a phenomenon that occurs only when clocks are set to standard time. Introducing an hour of misalignment between solar time and circadian time perpetually deprives sleep, which explains all the negative trends that are associated with daylight saving time. While all residents of Maryland would suffer from the ramifications of extending DST through the winter, I often hear this issue discussed in the specific context of school start times. The academic day at most middle schools and high schools in Maryland already begins before the earliest time of 8:30 recommended by tens of organizations dedicated to pediatric health, forcing students to bed all their own biology to arrive at their morning classes on time. DST shifts school start times 1 additional hour earlier relative to the time of sunrise, negating all efforts to give students a healthy amount of morning sunlight before school. As a current high school student, the proposal or the prospect of seeing the sun first on January mornings halfway through my first class of the day instead of during my drive to school does not particularly appeal to me. No adjustment of time can make winter feel like summer, though extending DST can make winters far more dismal. I ask anyone who's interested in keeping time honest and helpful for an unfavorable report on House Bill 165, which seeks to redefine midnight as 1 hour before the middle of the night at the expense of quality of life and life itself. Thank you for listening.
Thank you for your time today. We appreciate it. Are there any questions for this witness? Yes, Delegate Kerr.
Thank you, Madam Chair. Mr. Crabtree, I have a question. If there had been an amendment to say that this would be standard time, would you still have come in unfavorable, or would you have been favorable with amendment?
I would have come in favorable if it were favorable with amendment if it had been modified to standard time. Or if that were being proposed, I would definitely request an amendment to permanent standard time. That would still satisfy the overall desire to end clock changes, but several organizations, the American Academy of Sleep Medicine, American Medical Association, just to name a few off the top of my head, all endorse permanent standard time and strongly oppose permanent daylight time.
Any other questions? Seeing none, thank you so much for your time today. We do have for the committee 2 virtual testimony, so we're going to wait a second for them to come on. The first one is Mr. JP, and the second one is Jens Christian. And I want to thank staff. Thank you for your work. Okay, I know this is a little bit challenging to do both, and we appreciate it. Good afternoon, sir. Will you please get started?
Yes, thank you. Hello, Honorable Chair, committee members. Thank you for having me. My name is JP. I'm the president of the nonprofit Save Standard Time. I'm here to ask that you would oppose House Bill 165 and recommend its amendment to permanent standard time. We oppose permanent daylight time. We support permanent standard time. We agree that ending the clock change is a good idea, but going with permanent daylight time is worse than clock change. It would force early waking to try to increase spending at the expense of health, safety, and education. Standard time is the real clock defined from the natural world, from the sun. It's best for the well-being of the public. This is the position of the American Medical Association, the American Academy of Neurology, the American College of Chest Physicians, the National Safety Council, the National PTA, even writers from Bloomberg, Cato, Daily Wire. This is bipartisan opposition to permanent daylight time and a call instead for permanent standard time. Mexico just recently restored permanent standard time. Permanent standard time is already observed in Arizona, Hawaii, all 5 U.S. territories, most nations on Earth. Your neighbor of Virginia just last month defeated a bill for permanent daylight time just like this bill. It's been tried in the U.S. Twice before. It fails. It costs children's lives. It's been tried and failed in other countries as well. Really, the crux of it is it makes your sunrise too late. Your sunrise in Annapolis today would have been at 8 o'clock in the morning, which is too late with most school and work starting around that time. A month ago, your sunrise would be at 8:30 if this bill were to put into place. It'd be after 8 o'clock for nearly 3 months. It'd be even worse in places in Western Maryland. So if you were to ask your constituents, do they want to set their alarm clock an hour early all of winter from November through March and get up and go to work or school in the dark on those dark, icy roads? They would say, no, don't set my alarm clock early. I want to sleep. But that's what this bill would force them to do. It would force them to get up early in the morning and go to school and work in the dark. So please oppose this bill, recommend an amendment to standard time, and I'd be glad to answer any questions you might have. Thanks again.
Thank you for your testimony today. Are there any questions for this witness? Delegate Lewis.
Thank you, Madam Chair, and thank you to the sponsor of the bill. Appreciate your comments, sir. My question for you is this: what would you say to people living in Greenland, Scandinavia, Alaska, maybe Tierra del Fuego, who live normally and productively under a meteorological regime that involves being in the dark a lot of the time? Is it so terrible to wake up when it's dark and finish your workday when it's dark? There are millions of people, humans have done it for millennia. How bad could it be?
Yes, well, you can look at rates of depression rise statistically the further away from the equator you are. There's a reason why most of the public lives at mid-latitudes and many dream of retiring to further southern latitudes closer to the equator. Rates of depression comparing Los Angeles to Seattle, I think, are 10% greater, and going into Alaska, 25% greater. And the way to combat that is exposure to morning light. They sell these sun lamps, and they recommend exposure to them in the morning to try to wake up the body and feel better. So if you were to ask your residents, do they want to move to Greenland? I think they would say no. And if you were to ask them, do they want to wake up an hour early in January, I think they would also say no.
Delegate Bandari.
Thank you, Madam Chair. Based on the information provided, it appears that the proposed bill aims to address the negative effects of biannual clock changes. The evidence cited suggests that the clock, to change the clock is associated with several negative outcomes. This is a health committee, such as increase in fatal car crashes, to depressive episode, to heart attacks, to stroke, workplace injuries, emergency responses to suicide and fatal car accident. Do you have any comment on that?
Yes, the action of changing the clock, bringing it forward every year in March, causes acute harm to health and safety. It does have a spike in heart attacks, car accidents, and other dangers. However, leaving the clock on daylight saving time also causes chronic harm to those same issues. When we stay on daylight time, we have elevated rates of cancer, heart disease, stroke, obesity. The science really does show that we need the exposure to morning light, and we need the circadian alignment, the balance of light in the morning and the evening. When we're on daylight time, we are losing light in the morning to add it to the evening, and that is causing less sleep and less quality of sleep each night that we stay on daylight time. So that is why it's the opinion of the American Medical Association and literally dozens of others that the current situation is the happy medium, the compromise, if you will, but the optimal solution would be permanent standard time, and permanent daylight time would be worse than the current situation.
Delegate Hill.
Thank you. So granted that daylight exposure earlier in the day is more positive than daylight exposure later, but whether it's earlier in the day versus later is a function of when we define the start of the day. So if you're a restaurant worker and you're showing up to work at 4 in the morning, your day is starting at 4 or 5 in the morning. If you're, another job, maybe you're a night dancer, maybe your day doesn't start to 1. So isn't it really, just stop the switching back and forth, and then maybe, even if it takes a while, as the previous witness says, we might have to figure out whether a 10 o'clock start day or a 7 o'clock start day is the better standard to use, but it really isn't a matter of whether it's standard day. I mean, all of these things were chosen. I mean, there was nothing about that fixed these times except for us. We chose what time we considered the start of a business day. We choose what time we consider the end of a day. Or what am I missing here?
Well, thank you for that question. If you are a shift worker, if you're working at night, if you're starting at 4 in the morning, statistically, you have a higher rate of cancer because you are lacking that exposure to the morning light. And if you were to implement permanent daylight time, you'd be forcing everybody to start earlier in the morning. So you would be increasing rates of cancer for the general population. Would we adjust? The history shows we do not adjust. When the U.S. tried this in 1974, we had deaths of children within the first month. So I don't know how many deaths of children would be worth it for the adjustment. Russia tried it for 3 years and they never adjusted. They saw students' test scores to crash and rates of depression to skyrocket. And if somehow we were able to get through this and adjust over several years, then there would really be no point in that, because if you are talking about permanently moving the clock forward and then also permanently adjusting schedules, you're right back where you started. You might as well just skip all of that suffering and go directly to permanent standard time, which really is the clock that is objectively defined from nature, where noon is literally the middle of the day and midnight is the middle of the night.
So I think what I heard you say is you don't think we would, but we certainly could. You said
history
suggest that we
shows,
wouldn't, but we could.
Thank you for the question. The history shows that we do not adjust. That is the opinion of the researchers, the doctors and scientists. Again, it was tried for 3 years in Russia and they never adjusted. And the first month that it was tried in the United States, it caused 8 children's deaths. So I don't know how many children's deaths would be worth it to see if we could adjust, but as the years pass, we've not seen that adjustment ever comes.
I don't see any other questions. Thank you for being with us today. I appreciate it.
Yeah.
We have next we have Jens Christian. Well, he comes up. I was going to ask the last witness, how's the weather in San Francisco? Because that's where he's testifying from. Oh, I should, yeah, how Riverside, California is. The following one is from Riverside, California. Probably better weather
Yes,
than ours.
Madam Chair, can you hear me?
Yes, how are you?
Fine, thank you. My name is actually pronounced Jens. The J
Jens?
has a Y sound.
It's great to see you. How's the weather in California?
Quite beautiful today. It's actually approaching about 16, 17 Celsius. We had a really chilly night last night after some rain, so it's back to good old SoCal weather again.
Wonderful. Well, tell us, give us your testimony, please.
Yes, thank you. Good afternoon, Madam Chair, members of the committee. My name is Jens Christian. I'm also a volunteer with the nonprofit Save Standard Time, and I'm here to testify in opposition to HB 165. I do support the position of the American Academy of Neurology, Society for Research on Biological Rhythms, and the American Medical Association who have all made it abundantly clear that permanent standard time is the clock that we do need to keep. Now, HB 165's permanent daylight saving time creates an unhealthy bias towards evening light. It would darken mornings, taking away light that is otherwise essential to human biology and cognitive functioning. And while I understand that permanent DST proponents, including the bill author, argue that evening light is more important, for the economy and mental health, particularly where seasonal affective disorder is concerned, the data actually indicates that it's increased exposure to morning light that stays off SAD and which the clock of standard time provides, and not DST. So HB 165 will more than likely trigger an SAD epidemic, and I do find that deeply concerning. So I urge you all to please read the NIH peer-reviewed medical journal paper by A.J. Louis from 1998, which concluded that the timing of AM light exposure best treats the disease. Now, relatives of mine actually who reside in upstate New York, and my brother who resided in Rhode Island for several years, they all remark how dark the mornings become with DST, especially in March when we spring forward. And before we fall back in November, it truly is hard on the body, and the misalignment between the sun and our social clock becomes quite pronounced during those times. And it's really disconcerting to see legislators ignoring failed historical precedents of permanent DST in the US in 1974, Portugal from 92 to 96, and in Russia from 2011 to 14, all which the provision was ultimately repealed. So please, let's not repeat failed history. We can stop switching clocks faster with federally pre-approved permanent standard time, which will actually meet constituent demands for any time changes right now. I ask for an unfavorable on HB 165. Thank you.
Thank you for being with us today. We appreciate your time. Are there any questions for this witness? Seeing none, thank you very much. You have a great day.
You too, likewise.
Enjoy that great weather.
Will do.
This actually concludes the bill hearing on House Bill 165. Next, we have House Bill 220, Public Safety, Militia Active Duty Combat, Maryland Defend Our Guard Act. Delegate Grammer, how are you?
How are you? Good to see you. I have
Nice
two
to
people,
see
if I
you.
could bring them up as well.
Actually, bring everyone, whoever you want.
Just the two, please.
Sounds great.
Should I get started?
Absolutely.
Thank you. Thank you, Madam Chair, Madam Vice Chair, members of the committee. For the record, Delegate Robin Grammer here to present House Bill 220, the Defend Our Guard Act. House Bill 220 limits the use of Maryland's militia to constitutional deployments. The event in my life that was most politically formative for me was the terrorist attacks of 9/11. Our country experienced radical policy changes thereafter. 9/11 was also the impetus of one of our country's largest and most recent military engagements, the war in Iraq. The Project for the New American Century, a neoconservative think tank, had lobbied for regime change in Iraq since the 90s. 10 of its members landed in the Bush administration. After 9/11, these people argued that we must invade Iraq due to its growing cache of weapons of mass destruction. No stockpiles of weapons were ever found, nor was any active program found for their development. It was also argued that Saddam Hussein harbored and supported al-Qaeda. The 9/11 Commission proved this to be false. What we did see is regime change in Iraq. As we look back at major conflicts of the last several decades, such as those in Iraq and Afghanistan, and we consider our policies as we face what will be a protracted conflict between Russia and Ukraine, we should think very carefully. To me, the most important reflections on our military engagements are given by those returning from deployment, such as the stories told by veterans returning from Afghanistan. These men and women talk explicitly about increasingly politicized military leadership, mission creep, and a lack of direction in military decisions. Most Americans are likely unaware that in addition to Afghanistan, U.S. troops have recently seen combat in Mali, Nigeria, Kenya, Somalia, Yemen, Syria, and Iraq. These burdens of these conflicts lay squarely on the shoulders of our sons and daughters. Many veterans suffer greatly from these conflicts. Thousands suffer loss of life or limb, carry the baggage of post-traumatic stress syndrome, or other mental health issues. When one of your constituents shares a Facebook post performing 22 push-ups, they likely do so with thoughts of a friend or family member who suffers from post-deployment mental health issues. We should also note that deploying troops to another country leaves us without support at home. House Bill 220, the Defend Our Guard Act, which has been sponsored in more than 40 states, attempts to deal with this problem. It does so by limiting the deployment of Maryland National Guard to its constitutional deployments, including declarations of war, deployments governed by Titles 10 and 32. Justifications for our foreign engagements should be clearly defined so that both the public and our service members understand what their goals are. Our service members should be guided by clearly defined victory conditions. Mission accomplished should be a predefined goal, not a banner to stand in front for a political victory. Our participation in wars that last decades and the public lamentations of broken veterans who question their purpose are indicators that policymakers should bring our deployments back to our constitutional bounds and that our Congress members need to do their jobs. The only war that our country should engage in is one that our Congress members should put their mark on. The historic principle is that military conflicts voted on will be more well thought, more clearly defined, and more succinct. We should defend those who defend us. With that, I'd be happy to take questions, and I ask for a favorable on House Bill 220.
Thank you. Who will be next?
Good afternoon. My name is Scott Spalding. I'm favorable for HB 0220. Good afternoon, Chair, delegates. Thank you for your attention. I'm testifying today because I'd like to take a moment to spend time discussing the real cost of war. Not in dollars, not the $6 trillion in counting, but the human costs. When I was a student at Towson University in 2006, after my first deployment, I was in class with a ghost. There was a young man in class who bore an uncanny resemblance to a man who I had helped put in a body bag. So I withdrew from that class. I can't take this moment without recognizing that my passion for this cause is driven by the Iraqi family I shot to pieces in 2004. The family who lost an eye, or the baby who lost an eye to our bombs in 2004, and the Afghan 7 years old whose legs were blown to pieces by a mortar in 2014. If they're still alive, they're the same age as my students at Parkville High School who hail from Iraq, Afghanistan, Syria, and Somalia, where our troops are in combat. My knowledge of their languages brings us together at times, but they don't know that I can't unlearn how to say stop or I'll shoot. I can't forget. It's the first thing I think of when I want to say stop to them, stop doing this. If today we hear someone speak about money or lost funding, I want you to think about the costs borne by others like me and the 37 million refugees of these wars, including those new young Marylanders. Some speculate that if Maryland passes Defend the Guard or some other state does, there may be retaliation by Congress reducing our state's budget. My father, a retired Vietnam veteran and DoD civilian, retired, is concerned that the Guard might punish me for being outspoken on an issue that they fear could affect their budget. I could be naive, but I don't believe Congress or my chain of command are that malicious. Besides, Maryland's Guard has done its duty. Would Congress be more willing to have no Guard at all than simply perform their constitutional duty to us? There's no wrong time to do the right thing, and I'm asking you to stand up for democratic leadership of our military. Representative Raskin, then state senator, I wish him a speedy recovery, supported similar legislation in 2009 and 2010. This bill is not a referendum on any particular war or war in general, but it's a demand that democracy be the process by which our country goes to war. In one speech Senator Raskin gave, he used one of my favorite quotes from Abraham Lincoln. He had said that the provision of war-making powers was placed in Congress because kings had always been involving and impoverishing their people in war, pretending that the good of the people was the cause. The current state of affairs places the president where kings had always stood. Please remember the real ongoing costs you've heard and weigh them against any speculative dollars. Remember that when you're discussing this bill, no amount of dollars can bring my friend back to his orphaned twin daughters who he never met. Think of my students in Parkville. Sorry. When I was in Iraq and Afghanistan, they would have been infants, and it could have been them. They know I've been to their countries, and we share the emotional cost of these wars every day. Lastly, remember, we're simply asking that the people, through their elected representatives, lead the military as it is keeping with the democracy. Thank you for your time.
I want to thank you, before we go on to the next witness, to thank you on behalf of the committee for your service, and thank your family, and we appreciate you sharing your personal story, okay?
Thank you.
It matters.
I'm sorry.
You don't have to be sorry. We respect you, and we're grateful to you. Who's next?
Hello, I'm here to speak in favor of House Bill 220 as a regular citizen. So I think that the central tenet of the bill, that the National Guard should only be used when Congress has declared war, is part of the constitutional duty of that body, is a good tenet for a bill because the National Guard has been overused and abused, and that hurts our country and it hurts Maryland. When they're away in different skirmishes, because it's hard to call it war when it's not been declared, then they're not available in our state for emergencies and for what that they're designed to do, for national emergencies and for things that come up here. Also, it's a great bill because it has bipartisan support. It's not Democratic or Republican to want our National Guard here and available to us when we need them. As well, it doesn't interfere with the ability of the governor or the president to address national emergencies. Some other important, I want to speak more on behalf, because I'm not part of the military, on why we need them in Maryland and how it affects Marylanders. For example, like in Oregon, when the National Guard was sent to Afghanistan, they weren't available to deal with wildfires at home. In Louisiana, being in Iraq, they weren't available when Katrina happened, or when they were in Syria and then COVID started. And then coming back, when they're brought back and then have to immediately address emergencies in their state, this creates burnout and low morale. As well, now, people that are in the military. No.
You can finish. Go ahead.
Okay. People in the military and National Guardsmen tend to be service-oriented individuals that have jobs as first responders and teachers, and these jobs are left vacant when they're away for months at a time. Business is shuttered, and so another reason that we need them here.
Thank you. Thank you for coming. We appreciate you as well. Are there any questions for this panel? I don't see any questions. Thank you very much for your time. Thank you. Again, thank you, sir, for your service to our country. Next, we have actually the rest of the witnesses, which are a lot, are all virtual. So I ask the committee for a little patience while we bring them up. We're going to bring 4 at a time. They're all favorable, and we'll see how that goes, okay? And those of you that are waiting for the last bill, thank you for your patience as well. Don't worry, we will pay attention, okay? Let's get started with, let's see. Mr. Laurel, we can't hear you yet because your audio is processing, so just give it a minute. Are the other ones on? Mr. Blitz, are you on?
Yes, I am.
Oh, good afternoon. Will you be so kind and get started, please?
Sure.
Thank you.
Madam Chair, Vice Chair, members of the committee, I'm Eric Blitz. I serve as the chair of the Libertarian Party of Maryland, and we strongly support HB 220. This Defend the Guard legislation is part of a movement in over 40 states to rein in the federal government's practice of using state National Guard units in undeclared and unconstitutional wars. These are the kind of wars that last a generation, have meandering or improper goals and justifications, are entered into under false premises, and cost tens of thousands of lives. They are the kind of wars that continue merely out of inertia, regardless of whether strategic goals are being achieved and regardless of the costs in lives and money. This bill should have bipartisan support that focuses on the benefit to your constituents who serve in the Maryland Guard. Despite engaging in many armed conflicts, the United States hasn't declared war since 1941. As a result, every war since World War II has been more controversial and less effectively waged. Declaration of war requires political consensus to be built for the mission and acts as an important check on the executive branch. Lately, the practice has been to rely upon statutory authorizations of military force. These AUFs stay on the books well after the hostilities that justified their passage, have ended and give the president a blank check for new military use. Currently in Congress, there's legislation to end the AUMFs that were passed in 1991 and 2002. These decade-old authorizations were used as the legal justification for the use of military force in 2020. And that's notwithstanding the fact that the Gulf Wars were long over and that the purposes that were used, or justifications used to pass those legislations had expired. That is not what our Constitution requires, and AUMFs are more often used as a method to avoid political accountability than to establish legitimacy. We ask you to protect the members of the National Guard. We ask for a favorable report on HB 220.
Thank you for your testimony today, Mr. Blitz. We really appreciate it. Next, we have Mr. Travis Beryl. You have to unmute yourself. Thank you.
Hi, thank you for calling me. I'm Travis Larrell. I live in Anne Arundel County. I served in the U.S. Air Force for 8 years, both active and reserve. And today I'd like to talk to you about my time in the 70th Intelligence Wing on Fort Meade, Maryland. I was on the Airmen's Council to hear complaints. On my very first day on the job, we had a young airman come in and request that his deployment be canceled. He discovered that his wife was pregnant and his deployment time would result in missing the birth. And he had a natural desire to help his wife during this time to see this child be born. The Air Force denied this request. This request was the first of many I saw, and most of which were denied. But I never saw anyone come in to complain about not being deployed. It was always the deployment that was the problem. See, we talk about the cost of war in lives and dollars, but there's also the everyday human cost. Deployments break up relationships. I've seen men promising attempts at college degrees. I've seen them break up small businesses that veterans were trying to create. There is always a toll paid in relationships and one's life being put on hold. And sure, sometimes sacrifices need to be made. Everyone serving understands that. But if the situation calls for such sacrifice on behalf of the men and women serving in the Maryland Guard, surely it's not too much to ask our Constitution to take the vote, to ask our Congress to take the vote the Constitution requires. That seems like a very reasonable ask, and I hope you all vote favorable on this. Thank you very much for your time.
Thank you for your service to our country, and thank you for being with us. Next, we have Stacy Wolfson.
Hi.
Good afternoon. You can get started.
Okay, thank you. I'm speaking today in support of HB 220, Defend the Guard. I'm a Baltimore native and a passionate Democrat in favor of peace. I'll admit that until the 2016 election, I was pretty ambivalent about political matters in general, and I was pretty apathetic in particular when it came to foreign policy. But if the last several years have taught me anything, it's that I'd like to see Congress step up now more than ever to ensure that we stay on the right path. As a Marylander, I'm proud to see that our state has the opportunity to lead by taking a step in the direction of ensuring this becomes reality when it comes to foreign policy. As the wife of a Purple Heart Marine veteran who is finishing his service in the National Guard, one of my biggest fears is that a future president will send my husband overseas to fight in a war that I do not support, perhaps over something as small as a tweet. Growing up, my understanding was always that Congress declared wars, the national military fought them, and our state's National Guards were at home to protect the people of their states. I have since learned this has not been the reality for many years. I am in favor of this bill because it pushes Congress to once again take on this role, and that makes me feel like my wishes are better represented than they would be by any given president. If Congress is not willing to declare war, then I don't think it's right that the National Guard should be deployed to support a war it doesn't endorse on my behalf. Going into year 3 of the pandemic, I think this is more relevant than ever. I got my COVID vaccine at M&T Bank Stadium with the National Guard helping out, and I want to know that they're here should another disaster befall us. So as a Democrat and a Maryland, to me, voting for this bill is a no-brainer, and I hope you think so too. Thank you.
Thank you for your time. We really appreciate it. Are there any questions? Seeing none, thank you so much. Next, we have Jessica Katzenstein. I don't know that I pronounced it correctly. You can feel free to correct me.
Nope, that was absolutely correct. Thank you.
Thank you.
Thank you. I'm very happy to be here. I'm here to speak also in support of House Bill 220. I am a PhD researcher. I'm a postdoctoral fellow at Harvard University. I did my research on U.S. police reform based in Baltimore. I'm also the author of a report for the Cost of War Project at Brown University on police militarization. And I'm here today to speak on one piece of this, the benefits of this bill, which is to ultimately minimize the conflict the US is involved in worldwide, therefore reducing the costs of war on domestic policing. I'll touch on 3 of those costs today. One, of course, is economic. US taxpayers have spent tens of billions of dollars at minimum on military originated equipment, militarized trainings, and surveillance technologies for police since 9/11. No study that I'm aware of has been able to show that this expense has diminished crime, particularly in poor neighborhoods of color that bear the brunt of both police violence and broader disinvestment in their communities. This expense, it's important to note, also entails massive opportunity costs. Every investment in drones, armored vehicles, and surveillance systems are dollars denied to education, infrastructure, and renewable energy. A second cost is increased violence. Militarization, incurred partly through our wars abroad, may encourage police aggression and violence, particularly against Black people at home. For instance, one study found that even when controlling for civilian demographics, violent crime rates, and rates of drug use, 1033 program, the DoD's program that transfers military equipment to US police, these transfers correlated with increased police killings of civilians. And finally, the militarization that is a consequence of our wars abroad also produces an erosion of police legitimacy at home. Studies have shown that overt militarization in the form of SWAT raids and protest policing often breeds fear and mistrust, especially in Black, Indigenous, and poor communities. As many officers themselves would agree, this can obstruct crime solving and undermine community policing efforts. So for these reasons, I encourage you to support House Bill 220. Thank you.
Thank you for being with us today. Are there any questions for this witness? Seeing none, thank you so much for being with us. Next, we have Carter Hill. Good afternoon, Mr. Hill. Will you be so kind and unmute yourself and give us your testimony?
Thank you, ma'am.
My
Good
pleasure.
afternoon. My name is Carter Hill, and I'm a representative for Defend the Guard in Delaware, as well as the treasurer for the Libertarian Party of Delaware. I served in the United States Marine Corps Infantry and spent about 18 months total in Iraq from 2003 to 2005. We're approaching the 20th anniversary of the unconstitutional invasion of Iraq, so the timing here is fitting. At one point, my team was tasked with locating several mass grave sites where Saddam's loyalists brutally murdered men, women, and children. The image of a child's skull with a perfectly round hole in the back of it will forever be seared in my mind. I've watched families forced to identify the remains of loved ones by fragments of clothing that still remained. I've seen the horrors of tyrants. I've also witnessed the horrors of what our own troops are capable of when they're led to believe they're fighting for a just cause. Have you ever seen a person looking out the window of a bus as you're driving down the road? Now imagine they're trapped inside, grasping the struts on either side of the window, screaming in agony. Now imagine that bus charred completely black and its windows blown out. Now imagine that person inside the bus looking out, grasping those struts framing the window, screaming in agony for eternity from a stiff, burnt shell of a body. That image, too, will forever be seared in my mind. I have seen the worst horrors of war. Our founders also knew firsthand the horrors of both tyrants and of war, and understood the necessary limits on the latter, despite the horrors of the former. I hope you now understand why they had the wisdom to require the entire congressional delegation to investigate, debate, and determine whether sending our troops into war is a worthwhile cause. I ask that you refuse to ship Maryland sons and daughters from their communities into war zones to perform unspeakable acts of horror in the name of liberty, and to be left with those horrors, in their minds without even the slightest due diligence from our elected representatives. I ask that you return a favorable report for HB 220. Thank you.
Thank you, Mr. Hill, for your service, and thank you for sharing your personal stories. You know, it makes a difference, so thank you very much. Who will be next? How about Ms. Brunnerhope? Jacinda?
Good afternoon.
Yes.
Yes. Madam Chair, Madam Vice Chair and committee members, I'm a civilian in Fulton, Maryland, and I support House Bill 220, the Defend Our Guard Act. Maryland National Guardsmen are indispensable to the health and safety of their fellow Marylanders. They are currently undermanned and fatigued from constant deployment overseas and jumping from one emergency to another domestically. Many of our guardsmen are first responders, medical personnel, educators, and essential workers who are crucial in times of crisis. Taking them away from their families, jobs, and the communities they serve and protect without a congressional declaration of war leaves Marylanders vulnerable. Sending our guardsmen overseas could lead to a Hurricane Katrina-type situation, where Louisiana guardsmen were in Iraq and not in New Orleans when the levees broke. The 10th Amendment of the Constitution solidifies the role of states in shaping national policy. The Defend Our Guard Act would force the federal government to follow what is codified in Article 1, Section 8 of the Constitution. If passed, Maryland can prevent our National Guardsmen from going into combat on foreign soil until a congressional declaration of war has been made. Please join other states in passing the Defend Our Guard Act and help keep Maryland and Marylanders safe. Thank you for your time.
Thank you. Are there any questions for this witness? Thank you so much for your time. We appreciate you. Have a blessed day. Mr. Mahare, did I mispronounce your name? You can feel free to correct me.
You were very, very close. It's Mahari. And I thank you so much for the opportunity to speak to the committee. I'm the National Communications Director for the 10th Amendment Center, and we are strongly in support of HB 220. I want to go into a little more depth on these authorizations to use military force that were touched on by a previous witness. An AUMF is not the same as a declaration of war, and it does not pass constitutional muster. In practice, these resolutions authorize the president to decide if and when he wants to take military action. The AUMF passed after 9/11 to authorize the invasion of Afghanistan remains in effect today. Presidents Bush, Obama, Trump, and Biden have all used this AUMF to justify independent actions to take military action all over the world. My emphasis on the president's independent action and decision is important, and it gets to the root of the problem with these AUMFs. They flip constitutional process on its head by placing decision-making power in the hands of the president. In effect, Congress tells the president, you decide if we're going to war, and then do it if you want to. This violates the constitutional separation of powers. Congress is supposed to make that determination. Basically, Congress is using AUMFs to usurp their constitutional responsibility to determine whether or not the U.S. should engage in military operations by letting the president make that call. One person should never have that much power. As James Madison put it, the executive has no right in any case to decide the question whether there is or is not a cause for declaring war. It's Congress's responsibility. Passing Defend the Guard will pressure them to do their job, and more importantly, it will draw a constitutional line in the sand and ensure Maryland is not complicit in violating the Constitution. I strongly urge you to pass HB 220, and I thank you for your time.
Thank you for being with us today. Are there any questions for this witness? Seeing none, thank you. I love your poster, Make Art Not War. Very beautiful.
Thank you.
Next, please. Can you unmute yourself? Miss Laurie Calhoun?
Yes.
Yes.
Hello.
Will you be so kind and tell us who you are, and you can start giving us your testimony?
Sure. I'm Lori Calhoun, and good afternoon. I'm here to speak in support of House Bill 220, the Maryland Defend the Guard Act. In the post-9/11 climate of fear that further terrorist attacks might be undertaken against Americans, both the U.S. House of Representatives and the Senate passed an open-ended authorization for use of military force, AUMF, effectively ceding both their right and their authority to limit the executive's ability to mobilize the armed forces of the United States to fight, kill, and possibly die in wars abroad. Rather than needing to confer with the Congress before sending troops into harm's way, the AUMF of 2001 vested in the president the power of a monarch to wage war at his discretion and according to his own timetable. With the unlikelihood that either the president will cede his war-making powers back to the legislative branch or the Congress will demand that they be returned, House Bill 220, currently under consideration, would provide the restraint needed to prevent the Maryland National Guard from being deployed in combat missions abroad at the executive's caprice by requiring that the US Congress pass an official declaration of war. I support the Defend the Guard Act because National Guardsmen enlisted to serve the country under specific conditions which have been bypassed since 2001. The politicians in Washington, D.C. have abdicated the most weighty of all of their responsibilities, that of determining whether and when soldiers must be sent to fight. Because Congress has neglected their responsibility under the Constitution to serve as a restraint on the war-making powers of the executive, the time has arrived for states to assert their sovereign rights and protect their local guardsmen from reckless and counterproductive deployments, as occurred throughout the past 2 decades of the global war on terror in several different countries for which no mission-specific AUMF was ever ratified by Congress. It is too late to do anything about the soldiers sacrificed in Afghanistan, only to withdraw from that country with the Taliban still in power in 2021. Nor can the tragic loss of guardsmen to suicide be undone. But House Bill 220, the Maryland Defend the Guard Act, will help to protect future guardsmen from such fates. Thank you for the opportunity to speak on this issue.
Thank you for being with us today. Lovely artwork as well. Are there any questions for this witness? Seeing none, thank you for your time. We really appreciate it. Next, we have Mr. Christopher Henriksen. Good afternoon, sir. Will you be so kind and give us your testimony?
Good afternoon, Madam Chairwoman and members of the committee. My name is Christopher Henriksen, and I'm a former U.S. Army soldier who deployed twice to Iraq from 2004 to 2008. I'm testifying today about HB 220. There are many reasons why this bill, allowing the state of Maryland to better control when and where their National Guard forces are deployed. However, my main reasons for testifying today will focus on psychological damage done to Maryland National Guard members and the larger crisis of massive increases in active duty and veteran suicides. Known statistics from the Watson Cost of War Institute at Brown University demonstrate that approximately 30,000 active duty personnel and veterans have died by suicide since September 11, 2001. A very striking statistic, not only for its large size, but because comparatively, only 7,000 service members were killed during deployments for the global war on terror. Well, really 14,000 because the US lost an almost equal number of American contractors, many of who were veterans themselves. And 2, historically, suicide rates for service members and veterans were lower than rates among the general population. Just for comparison purposes, I'd like to point out something rather morbid, and yet I think very key to this discussion. 13 members of the Maryland National Guard gave their lives in American overseas conflicts since 2001. It would be fair to presume then that based on the statistics I just mentioned, that approximately 65 members of the Maryland National Guard would have killed themselves in the same time period. That's not simply 13 lives lost or 13 families destroyed. That's 78 lives lost and 78 families destroyed. Now, a host of factors play a role here to include both general aspects of military deployments, such as high exposure to trauma, stress, military culture and training.
You can finish your thought. It's okay. Go ahead, continue.
Thank you. Continued access to guns and the difficulty of reintegrating into civilian life. An aspect specific to the post-9/11 era of combat, which includes a huge increase in exposure to improvised explosive devices, IEDs, an attendant rise in traumatic brain injuries, and modern medical advances that have allowed service members to survive these and other physical traumas and return to the front lines in multiple deployments. All we're asking is for Congress to place their names on the line before Maryland National Guard forces are forced to place their lives on the line. Thank you for your time.
Thank you for your time. We really appreciate it. Are there any questions for this witness? Seeing none, thank you for being with us today. We really appreciate your time and your expertise. Okay?
Thank you.
My pleasure. Mr. Otto Dason, did I pronounce it incorrectly?
That's fine.
How do you pronounce it?
Dawson.
Dason? Yes, good afternoon. How are you?
Good. Thank you for giving this opportunity to speak. My name is Otto Dawson. I know you've been hearing from several other voices on this topic that might carry more weight than mine, as I've never served our country. But this bill is extremely important to me, being a son of a recently deceased Vietnam veteran. Although he was drafted, this bill wouldn't have protected him, but his experiences were the same as the veteran fighting in another undeclared war and the trauma they endured, as you've heard in such testimonies earlier. It's the same trauma I witnessed in my father experienced decades after.
Can I ask you, can you get a little closer to the microphone? You're coming in and out. I'm sorry.
Oh, I'm sorry. I apologize. My headphones are not best.
It's okay. That's
Is that
better. Are you
Okay.
driving or are you pulled over? Are you?
I'm pulled over. I'm
Okay,
pulled
great.
over, so-
Just want to make sure you're safe, but go ahead. Give us your
Yes,
testimony.
I'm sorry.
It's okay.
So, although this bill wouldn't have protected my father who was drafted, it would have protected guardsmen who experienced the same trauma that he saw in fighting overseas, and the same trauma that I witnessed in him growing up with the slight sound of any loud noises, he would set him off and trigger him. And that's just something that I noticed as a kid and that I experienced from him. And I just would like to really consider passing this bill. And I just wanted to thank you all for your time.
Thank you for your time and for, sharing your experiences, okay? We really appreciate it. Are there any questions for this witness? Thank you so much for your testimony today. Drive safely, okay?
All right, thank you.
My pleasure, our pleasure. Are there two other witnesses waiting? I know they were not on there earlier, and that is Jim Bovard and David Swanson. So those are the two that are left. Are they waiting? They're not waiting? Okay, since they're not waiting, we're going to actually conclude the testimony on House Bill 220. Thank you for being with us today. We appreciate it. We are now, for the committee to know, we are on to the last hearing of the day, which is House Bill 172, Delegate Kerr, Health Occupations Licensed Athletic Trainers Dry Needling Approval. Will you be so kind, Delegate Kerr, and bring your panel, please, your sponsor panel, if they can come up with you. That will be wonderful. And that is William Robinson, Jane Miraglia, Colin Francis, Bill Pitcher, Sean Nelson, and if there are not enough chairs, just bring the chairs. Bring one from the back. Okay? And thank you for your patience in waiting. I know you're the last bill of the day, but look, everyone is here waiting to hear you. So, Delegate Kerr, will you be so kind and get started?
Yes, Madam Chair, I'm sorry I'm not bringing any tasty invasive species or a brief hearing.
But you owe it to us. You better bring some sweets.
Well, good afternoon. Welcome to the last bill of the day. I'm Delegate Ken Kerr. I'm here today with House Bill 172, Health Occupations, Licensed Athletic Trainers, Dry Needling Approval. So House Bill 172 involves scope of practice. These bills always face opposition as academic preparation and clinical experience outpace the scope of practice statutes. One practice of medicine will invariably, inevitably seize its territory encroached upon and seeks to protect its turf, even as other beneficial practices evolve and offer new health benefits. In the case of athletic trainers, using a tool commonly associated with acupuncture, the filiform needle, the claim of infringement is unfounded, as my panel and other advocates will demonstrate. Simply put, the athletic trainers are asking for the authority to perform dry needling, which acupuncturists will claim is the same as acupuncture. We contend Maryland law specifies it is not. So let me start with an analogy. As a college professor, I will remind you that an analogy is a comparison of two things for the purposes of explanation or description.
But you're not grading us, right?
So the violin was invented in 1845 in Italy. What differentiated it from its processor, the predecessor, the viola da gamba, was a bracing technique that allowed thinner wood to be used, which made the tone louder and more distinct. In addition to the bracing innovation, the violin had strings, which were made of sheep intestines, and wooden pegs, which allowed the strings to be tuned. Antonio Stradivari perfected the design, and interestingly, it was not the design of the wood, but the varnish and the bracing techniques that gave it its prized tone. Then, in mid-18th century in Spain, Francisco Sanguino used the same bracing techniques, similar varnishing techniques, and the similar woods to create the acoustic guitar. The guitar included the same wooden pegs, the same sheep intestine strings, so the instrument could be easily tuned. So these two instruments, the violin and the guitar, had the same technological origin, but only the most unfamiliar of observers would confuse one for the other. And to the professional musician, these two have very little in common. They're held differently, the strings are manipulated differently, and the skills used in playing one are not easily transferable to the other. Identical origins, different instruments, same broad outcome. They make music, but few would confuse the sound of a violin for that of a guitar. It's like telling a guitarist, you can't play guitar without a violin license. So similarly, acupuncture is a practice of medicine with ancient origins in China dating back about 3,000 years. It was about that time that qi, life energy that flows through the body, and the meridians, a study of the meridians, the lines along which this energy flows, were identified and mapped. Through the millennia, the practice improved and evolved and advanced. Insertion points along the meridians were more precisely defined and identified and standardized, largely through thousands of years of practice. It wasn't until 1973 that the Federal Food and Drug Administration approved the filiform needle for use in acupuncture for experimental use. And not until 1996 did the FDA determine that needles were safe and effective when used by licensed practitioners. It's important to note the FDA did not approve the practice of acupuncture, only the use of the filiform needles. The practice of acupuncture and that licensure is left to the states. So filiform needles are also used in the practice of dry needling. Dry needling is a practice permitted in Maryland and performed by physical therapists. It's important to recognize the origins of dry needling are drawn from principles and scientific research-based conclusions of Western medicine. Acupuncture is based on Eastern traditions. Dry needling effectively treats musculoskeletal pain and dysfunction, while acupuncture aims to influence the energy and the meridians. The only similarity between the two practices is the use of a common tool, a fine needle. In 1942, Dr. Jane Travell and colleagues first published a report on the method of injecting needles into trigger points. In 1979, Dr. Carol Lewitt concluded that the effects of these injections were primarily caused by the mechanical stimulation of a trigger point with the needle alone, and not a medication being injected through the needle. Since then, dry needling has been widely used for the treatment of trigger points in skeletal muscles. More recent studies have found dry needling to be most effective when a local twitch response is elicited, probably because the rapid depolarization of the muscle involved, the fibers in the muscle involved. After the muscles finish twitching, the spontaneous release of electrical activity subsides, the pain and dysfunction are dramatically decreased. Conversely, acupuncture techniques does not aim to necessarily even pierce the muscle, nor cause the important muscle twitch response that is so important in dry needling. The central issue here is whether dry needling and acupuncture are the same thing. Maryland law says it's not. The athletic trainers say it's not. 28 states and the District of Columbia say it's not. So the burden is actually on the Maryland Acupuncture Society to prove that it is. Last year, the same legislation passed the Senate 45-1, but the House did not bring it to the floor for a vote. So after your careful consideration today and hearing all the testimony, we request a favorable committee report for House Bill 172.
Thank you. And I'm glad you're not going to be grading us. It was very good, though.
I'll pass out the quiz here in a little while, so I hope you took notes.
They'll do better than I will. Who's next?
I am, Madam Chair.
Go ahead.
All right. Good afternoon, Madam Chair, Madam Vice Chair, and members of the committee. Thank you for your patience today in hearing us. My name is Jane Maraglia, and I'm the Maryland Athletic Trainers Association Government Affairs Committee Chair. Athletic training encompasses the prevention, examination, diagnosis, treatment, and rehabilitation of emergent, acute, and chronic injuries and medical conditions. Immediate and emergency care is one of our 5 domains of clinical practice. Our clinical excellence in acute care of injuries is why a study on educational backgrounds on athletic trainers and physical therapists found that athletic trainers were more prepared for dry needling certification. The the Dry Needling Institute, Myopain Seminars, and Structure and Function are just a few of the national organizations who certify physical therapists, chiropractors, and athletic trainers in dry needling. They are the ones who have determined that athletic trainers have the educational requisites to obtain dry needling certification. They are the ones who are accredited to teach the dry needling certification and demand the exact same strict standards from all healthcare providers with required advanced training, competency test, and supervised hand-on experience. We worked with the Maryland Board of Physicians on the necessary administrative changes needed to document the completion of all requirements. When drafting this bill, we also met with the American Physical Therapy Association of Maryland, the Maryland Chiropractic Association, and the Maryland Acupuncture Society. The acupuncturists are the only state association to raise an objection to the bill, as they believe dry needling is the same as acupuncture. We, along with the physical therapists and chiropractors, respectfully disagree. This is why all 3 of us have in our scope of practice that dry needling is not performed for the purpose of acupuncture. And as the delegate said, COMAR has vastly different definitions of dry needling and acupuncture. House Bill 172 aligns with the precedent set in COMAR, maintaining the same stringent standards as all other healthcare practitioners in the state of Maryland who are certified to dry needle. Please vote favorably for House Bill 172, and thank you.
Thank you. Who's next?
Hello, my name is Colin Francis. I'm an athletic trainer and the executive director of the nonprofit organization, the Baltimore Area Sports Health Initiative. I'm from Prince George's County originally, and I live in Baltimore City now. Up until the recent events in the National Football League, most people didn't even know what an athletic trainer was. My job is to do everything I can to help the players stay safe and return from injury as fast and as strong as possible. After the recognition and evaluation of an injury, we are responsible for the acute care, management, and long-term care of the athlete. All the treatment and rehabilitation needed is done in my office. Unfortunately, in this state, I can't do everything I have been certified in to help the athletes return to play. Adding dry needling to my practice will allow me to use an advanced skill that I have been formally trained in to help the athletes. Before moving to Maryland, I served as the head football athletic trainer and director of rehab at Indiana University. My dry needling certification was hosted by IU, and for the entire course, lab, and lecture, I was educated alongside physical therapists, athletic trainers, and chiropractors. For 2 years, I was able to use this technique with the football players. IU had a staff of about 15 athletic trainers, and in the 2 years I worked in Indiana after my certification, there was not one adverse reaction to the treatment for any of the student athletes. Most of the patients described the treatment as a true game changer when it came to their injuries, a specific modality that allowed them to perform. It allowed athletic trainers to use their anatomical basis and skill that really uses their knowledge to the full capacity. While working in the college level in Indiana, I found great success in patient outcomes, and I was excited and eager to use them here in Baltimore. I pride myself in being innovative and creative when working with the athletes. That is why I ask for your support of House Bill 172. I appreciate your time and welcome any questions.
Excellent timing. Go ahead. Who's next?
Good afternoon, Madam Chair and members of the committee. My name is Sean Nelson. I'm an athletic trainer, EMT at the United States Naval Academy. I sit before you today in favor of House Bill 172, which would add dry needling to the scope of practice for athletic trainers. I offer perspective as a panelist who does not possess the certification of dry needling, but who has witnessed firsthand the benefit of dry needling adds to a clinician's expertise and swifter patient outcomes. Like many collegiate athletic trainers, we have unparalleled access to our student athletes compared to other allied healthcare professionals. We are clinicians who conduct evaluations, follow-ups, perform daily treatments, rehabilitations, and provide emergency care. With the demand of a football season, the days that precede game day are imperative for athletic trainers to optimize recovery, return players from injury. Time and injury are inherent limiting factors in sport. Demanding schedules such as the Academy can consist of 6 classes per day, noon football meetings, pre-practice meetings, practice itself, while also finding time to eat, study, and rest. It's a lot. For our programs, dry needling has shown to minimize pain, improve function, return athletes to peak performance, respective of both time and injury. With a student body of 4,500, a third of which are student athletes, it is difficult facilitating appointments with other providers who are unable to have the same access we as athletic trainers do. To that point, not every physical therapist, chiropractor, DO, MD holds dry needle certification. With approval of House Bill 172, athletic trainers in the state of Maryland will be able to bridge the gap of access due to lack of providers as well as accessibility. We are asking to be on par with the majority of our colleagues across the nation. Thank you for your time and opportunity to speak on favor of House Bill 172.
Thank you for being here. Who's next?
Thank you, Madam Chair. I speak to you today as one of the few athletic trainers in Maryland that is allowed to perform dry needling. I can do that because I'm also a licensed physical therapist. Being dual credentialed for over 20 years.
Can you give us your name, please?
I'm sorry?
Your name.
William Robinson.
Thank you.
Sorry.
Go ahead. It's okay.
Yeah, so being dual credentialed for over 20 years, I can say without reservation that athletic trainers are clearly educated to a level to take the advanced certification course to perform dry needling. My colleagues have been sidelined by antiquated legislation, and therefore their patients are being denied a productive treatment opportunity. I completed the appropriate dry needling training in 2014, and for the past 9 years have safely performed dry needling on countless patients without any adverse effects. These advanced certification courses are exhaustive and cover all aspects of the treatment and any possible negative outcomes. The courses teach you how to deal with and respond to any adverse events that may occur and how to avoid them in the first place, including potential life-threatening pneumothorax. Allowing athletic trainers to perform dry needling would be consistent with 28 other states and the District of Columbia, and follow in accordance with the training standards set forth by several educational outlets. Why would these businesses that teach these courses risk educating an individual teach them in an invasive technique if that individual was not qualified to perform the task? Doing so would be a perilous liability risk for these corporations. Yet consistently we see these businesses offering the same course to athletic trainers, to physical therapists, and chiropractors alike. Dry needling is an advanced technique and it requires advanced training. And we can debate with the acupuncturists all day long about what happens when you insert a needle into the body. But bottom line, the Maryland law clearly states that dry needling and acupuncture are not the same thing. And the law clearly states that physical therapists can perform dry needling. So why can an athletic trainer not? Both have completed the prerequisite education requirements to take the course. Both can complete the course and learn the technique. Why place an arbitrary limit on the patient population in our state that can receive this safe and effective modality? Thank you for your time. I urge you to support Maryland House Bill 172 so we can increase the patient access of Marylanders to this effective modality.
Thank you. I have the last person for the panel is Mr. Bill Pitcher. Will you want to bring a chair or someone can sit in the back and then we'll open it up for questions. Thank you so much for being flexible.
Thank you, Madam Chair, members of the committee. Bill Pitcher on behalf of the Maryland Athletic Trainers Association. I've served as their legislative and legal counsel for a number of years now. And obviously in support of this bill, I'd like to see you vote in favor. But I think that there's something that hasn't been covered yet that I wanted to just make sure that you know about. Your counsel might want to check this citation, 95 opinions of the Attorney General 138. That opinion came out a few years ago when the physical therapists had this very same bill hearing that we're having now. And at the time, they were opposed by the acupuncturists. with the same argument that you're going to hear today, and that is that acupuncture includes dry needling, and dry needling is acupuncture, and therefore the twain shall not meet. We've already talked about how the Comar regs do distinguish between acupuncture and dry needling. Beyond that, this opinion of the Attorney General, which came out at the request of the Acupuncturist Board, has ruled, and an opinion of the Attorney General goes beyond what a letter from the Attorney General on a bill might be. An opinion of an Attorney General is very similar to an opinion of a court and carries much the same legal weight. So what they ruled, and I'll just read you a couple of sentences here, which is right on point, that first, the Acupuncture Board believes that the authority to insert needles is reserved under the Acupuncture Act to just them. The Attorney General disagrees. The authority to use acupuncture needles for therapeutic purposes is not reserved exclusively to acupuncturists. The scope of practice, and this is important for this committee on a lot of different issues, scope of practice of healthcare professions may overlap and confers extensive discretion on the licensing boards.
It's
So
okay,
with
you
that,
can
I would
finish
opine
your
to the
thought.
committee that, I'm sorry, Madam
You
Chair.
can finish your thought.
Yeah, well, with that, you can see that the Attorney General, back a long time ago, has said that these are not the same things, and that for the purposes of giving consumers the choice of healthcare providers to see and providers to be able to treat, that this would be a good thing for these people's patients.
Thank you. Will you be so kind and provide the opinion that you have to council and to the chairman Rosenberg where the bill will be assigned to? Thank you very much.
Okay.
Are
Happy
there
to.
any questions for the sponsor of the bill and his witnesses? I'm going to start with Delegate Rosenberg, followed by Delegate Bagnall.
Thank you, Madam Chair. Professor Kerr began his presentation with an analogy to a Stradivarius. I would just like to ask any one of the athletic trainers here if you know whether Richie Bancells, when he was the Orioles athletic trainer, ever said to Earl Weaver that his work on his starting pitcher's right arm was the equivalent of working on a Stradivarius. Not Palmer. Palmer might have thought his arm was a Stradivarius.
If he didn't, he should have.
Good for you.
All right. Thank you. Delegate Bagnall.
Thank you, Madam Chair. And Professor Kerr, I did do my homework on this bill in advance of it. So I went back and watched the hearing from HB 404 from 2019. For our new members, that was before we were paperless, so I had to watch the hearing. And that was the changing of definition for licensure for acupuncturists. And the Occupational Therapy Association, the chiropractors, the nurse practitioners, the athletic trainers all came in support, but they raised a concern that many health practitioners overlap modalities, and they didn't want to have dry needling become the exclusive domain of the acupuncturists. So is it the opinion of the athletic trainers and whoever is equipped to answer this, that this continues to be a shared modality, and that is your impression of this debate that we are having?
Thank you, Delegate. Yes, we still believe that it is a shared modality. So between healthcare professions, physical therapy and athletic training specifically, we have a lot of overlapping modalities that we use: ultrasound, electrical stimulation. Dry needling is just another one of those modalities. We want to stay with the same strict requirements that it's an advanced training. So hence we're here today to put the laws in to be able to do that advanced training.
Delegate Chisholm, followed by Delegate Collison.
Thank you, Madam Chair.
My pleasure.
Either one of the athletic trainers at either Indiana University or Naval Academy, I'm assuming both of you were with the football team or with one of the large. When you are with the team, both in practice and in the game, obviously you have staff with you. How many chiropractors are traveling with you at practice, after the game?
So I can speak from my experience at Indiana University. We did not travel with a chiropractor. And when I worked at Morgan State University, I was the head football athletic trainer there in the state. We did not travel with a chiropractor. We had a chiropractor that came in to see our patients, and we was a chiropractor that we were able to refer to if it fit in their class schedule, practice schedule, work schedule, but we did not travel with one.
Thank you, Madam Chair.
My pleasure. Delegate Collison.
Thank you, Madam Chair. So I'm going to try to sneak two questions in.
You can do it.
One is, Delegate Kerr, I finally understand the difference, I think. So is it fair to say that acupuncturists don't actually necessarily do dry needling because they are doing something that is different? So that's the first question. And the second question is the training that that athletic trainers have, is that generally accepted as part of the overall training to be certified as a athletic trainer, or is that in addition? I think I heard that it's actually an additional training. So tell me how that fits into the training of for the profession.
Yeah, so I'll start with the second one. In some states, dry needling is part of the graduate degree program, and athletic training has moved to a master's degree program. So in Maryland, it is not currently taught the skill. It has gone as an overview. There's guest lecturers that come in and go over the theory and the practice, but it is not currently taught itself. There was a study that was completed looking at the educational requirements to be dry needle certified. In that study, it found that in the baseline education for athletic trainers, 89% of the necessary skills and education were taught at the baseline education. Comparatively, physical therapists were taught 86% of that baseline skill. So structure and function is one of the huge studies who did it, found that within the course of a weekend, that within those 80 hours, that 11% can be taught where athletic trainers can competently and safely dry needle. And then to answer your first question, I do not necessarily have a straightforward answer for you because I do not know the full practice of acupuncture, so I don't want to speak on their behalf. So I know that they use the same thin filiform needles and that they go based off of their training. So I can only say that as athletic trainers, we are doing it based off the Western training and the certification that we are taught.
Thank you. Thank you, Madam Chair.
My pleasure. We have Delegate Johnson, followed by Taveras, followed by Hill.
Thank you, Madam Chair, and thank you, panel. I've got a question. I was looking some things up, and I saw no prerequisites are needed for the 3-day course for the dry needling. However, registrants must be licensed PT, ATC, DC, MD, DO, NP, PA, or OT for acupuncturists in their respective state or county. So is that correct that in Maryland you have to be an acupuncturist or one of these other field in one of the other fields to take the course and do dry needling?
Correct.
Yes.
Yes. Yes. You would have, so when they're saying that a prerequisite, probably what that specific site is referring to is that there's no one of their prerequisite courses. Sometimes when we do continuing educations courses, each of them build upon another level. So I've done functional dry needling level 1, functional dry needling level 2. So I couldn't take level 2 before I had taken 1. That was a prerequisite. But these courses you would be required to have a license as an athletic trainer, as a physical therapist, chiropractor, whatever. You have to have a functional license where you're working as a healthcare practitioner in order to take the advanced certification course to learn how to do the technique.
Sure. Madam Chair, thank you. So an acupuncturist could take the courses and do dry needling if they chose to? Okay, yeah. All right, thank you. Thank you, Madam Chair.
Delegate Taveras, followed by Delegate Hill.
Thank you. I have a question actually for the individuals that are permitted and certified in other states that do provide dry needling. And I'm speaking with regards to the athletic trainers in these other states that permit this. So how long are their training hours? Here we're requesting 80. So what's the required number of hours for training in other states?
I don't have the exact number of hours that was required in Indiana. Jane does, but we have, at IU, our background of the structure and function class that they talked about, and plus the base knowledge of being an athletic trainer and a 4-year degree and master's degrees on top of that.
Madam Chair, will you allow a second response?
Go ahead.
Thank you. So within the past, I believe, 3 years, there have been 5 states that have passed dry needling for athletic trainers. So Alabama requires 25 hours for athletic trainers. Kentucky requires 54. Nevada requires 25. North Carolina requires 54. And West Virginia only requires completion of an educational instruction course approved by their board.
All right, thank you. Delegate Hill, followed by Delegate Bandari.
Thank you. So I sat down last year when this was before us, and I watched the dry needling course summary and what was being taught. And most of the courses that I found were being led by acupuncturists. And then I spoke to the acupuncturist, and I spoke to you all, and was trying to figure out what the argument was. And it seemed like, and I need you to clarify that what I was hearing then, may be different now, was that your argument was if physical therapists are approved in Maryland, then our base training is similar enough and maybe more in-depth than we should too. So it was not about whether your experience and background root training was similar to acupuncturists, but it was if we as Maryland's legislative body have already opened up the door for physical therapists, we can't justify not letting you through the same door. Is that right?
Well said.
Yes, ma'am. We are following the same strict precedent that's in place for the Maryland physical therapists and chiropractors who are dry needling. We are not asking to acupuncture. If we were asking to acupuncture, then we would completely agree that we would need to do the same education and treatment, or education and hands-on experience that acupuncturists have.
Thank you. Delegate Bandari.
Thank you, Madam Chair. Just for a clarification, based on the hearing, it seems like dry needling and acupuncture are both techniques that use the needles, right? In the goal, you see some of the differences between two. The goal of dry needling is to release tension and improve muscle function by causing a twitch response that can alleviate pain and promote healing. On the other hand, acupuncture is kind of more traditional one, and that can be used to treat broader range of conditions, including digestive disorder, respiratory issues, emotional imbalances, and they put that needle there in the body for a long time. Is that correct?
Overall, yes. I can't speak to how long they keep the needles in because I've not had that training, but everything else, yes, sir.
Thank you.
Are there any other questions for this panel? Seeing none, thank you very much for your time and all your efforts.
Thank you.
Thank you.
Next, we have an unfavorable panel. We have Thomas Igno, Lynn Vance, Dr. Brandi Armijo, Sherry Black, Tiffany Smith-Williams. Will you be so kind, all 5, and come up? Good afternoon, and thank you for waiting, for being patient. We appreciate it. And who can get started, please?
I will start.
That's wonderful.
And thank you for waiting.
Our pleasure.
Good afternoon, Madam Chair, Vice Chair, and honorable members of the committee. My name is Sherry Black. I'm a licensed acupuncturist. I've been practicing in Maryland for 17 years, and I'm currently Vice Chair of the Maryland Acupuncture Board. I speak today on behalf of a coalition of 3 healthcare boards: the Acupuncture Board, the Board of Chiropractic Examiners, and the Board of Physical Therapy Examiners. We oppose House Bill 172 out of concerns for the safety of the citizens of Maryland. Our directive is to protect the public, which necessarily means a careful review of the safety issues concerning any expansion of practice. The facts establish that athletic trainers do not have sufficient equivalent academic or clinical training to support requested expansion of their practice. To have a master's in athletic training requires 60 credit hours. To have a master's in acupuncture requires double that, and to have a master's in physical therapy requires an additional 26 hours. Chiropractors, physicians, dentists, and veterinarians all have doctorates and yet are still required to take additional training before performing dry needling. Currently, only a third of athletic trainers meet the current standards for certification and competencies in athletic training. And a master's degree is only one quarter of the way toward a doctorate, which requires an additional 3 years.
Will you be so kind and put the microphone down just a little?
Surely.
Yes.
80 hours of training is simply not sufficient to protect the public. The protection of the public demands that we
Don't
take
worry about that. You can finish.
advantage of thousands of healthcare professionals throughout the state who are already deemed as qualified to do dry needling. In the interest of protecting the entire public, including the elite athletes that are being talked about today, athletic trainers need to invest more effort into developing global standards to expand their practice. And instead of relying on standards approved by the state for physical therapists whose foundational training far exceeds theirs. So for these reasons, our three boards would oppose House Bill 172 and respectfully request that you vote unfavorably on this bill.
Thank you. Thank you for your testimony. Please put the microphone a little lower as you speak. Introduce yourself. Who will be next?
Good afternoon, Committee Chair, Vice Chair, and other honorable members. I am Tiffany Smith, the Executive Director for the Maryland Board of Acupuncture. I come in my testimony as in opposition to HB 172. The board submitted a letter of opposition in cooperation with the Board of Physical Examiners and the Board of Chiropractic Examiners, a coalition of about 9,000 licensed practitioners. Dry needling, like acupuncture, is an invasive procedure that qualified licensed practitioners have the privilege to offer Maryland residents. This privilege is awarded after rigorous instructional and practical preparation. More specifically, acupuncturists must complete no less than 128 credits for a master's degree from the Maryland University of Integrative Health. Physical therapists must complete at least 96-hour credits for a master's degree from the University of Pittsburgh. And conversely, an athletic trainer can graduate with a master's degree from Towson State University with 60 credits. Furthermore, athletic trainers have not established a professional credential or supplemental curriculum that addresses the gap in preparation between themselves and the aforementioned practitioners. This is a fact that was confirmed by a fact sheet from their National Association of trainers. Instead, they are leaning on the standards created for physical therapists and chiropractors who have different training. Physicians, dentists, and veterinarians that insert needles in the same or in the name of acupuncture or dry needling train as much as 300 additional hours before inserting those needles. And that's in addition to their practice-specific preparation. This fact further highlights the inadequacy of an athletic trainer's training to perform an invasive procedure after only 80 hours of a course or an advanced training. There are 35,000 physicians in addition to 9,000 licensed practitioners in Maryland that have the potential to use needles in comparison to 700 athletic trainers. 44,000 practitioners is certainly an ample number of well-trained professionals that can offer dry needling safely to Maryland residents. In the interest of protecting the public, the primary directive of a health occupation board, and all those that help shape health policy, the board respectfully requests an unfavorable vote on HB 172. Thank you for your time.
Thank you for your testimony. Who will follow?
I think so. Okay. Good afternoon, Madam Chair, committee members. My name is Dr. Brandy Armijo. I'm a licensed acupuncturist for 13 years, practicing in Maryland for 11 years. I'm a professional member and chair of the Maryland Board of Acupuncture. I'm here in opposition of House Bill 172. Throughout the years of practice, I have had many patients come to me that have had dry needling and reported injuries and terrible pain with minimal successes. Adding more providers with such minimal education in needling is very concerning to me as a parent who have had many providers suggest dry needling, and I am uncomfortable letting anyone treat my children with dry needling due to the lack of appropriate needle training. I have children in high school sports, and this bill makes me very nervous and severely concerned to see that minimally educated providers in needling practice are wanting to treat athletes of any age. This bill would allow athletic trainers to treat high school athletes as needed for acute injuries. Then the schools would be able to hire ATs and treat underage children without full consent and of the parent because they're believed to be appropriately trained. Not only is treating athletes of any age on a field, in a locker room, or any other potentially dirty environment a major concern to patient safety. Acupuncturists Without Borders uses ear acupuncture during disasters for trauma throughout the world and can do this safely due to appropriate clean needle training techniques. And dry needle does not require this education or certification and could encourage infections and other medical challenges due to an unsterile environment for treatment in the field that athletes could encounter. I respectfully request you vote unfavorably on this bill. Thank you.
Thank you for being here. Who will be next?
Madam Chair, distinguished committee, I'm Dr. Tom Ingenio. I'm a doctor of acupuncture and Chinese medicine and the VP of Public Affairs for Maryland Acupuncture Society. This bill at its heart is just another attempt for a different healthcare group to skirt the acupuncture training requirements and appropriate acupuncture through rebranding and public disinformation. This time, the attempt is most egregious. We are seeing PTs and chiropractors redefining what dry needling is, all the while discrediting larger amounts of Western-based acupuncture research and whitewashing the history of acupuncture. Now, the discussion is allowing professionals in this state who have a bachelor's level education to perform an invasive technique. Why does everyone else in this state who is performing dry needling at this time required to have a master's level minimum education? Why do most states require a 3+ years of education for acupuncture to be able to pick up an acupuncture needle? Yet others can appropriate it with a mere 60 to 80-hour course. At least the PT board requires separate certification and registry of every PT practicing dry needling. Athletic trainers want a shiny new moneymaker without having to take the steps to approve quality courses and ensure those wanting to practice have passed the proposed standards. They're stating that this won't impact the physician's board, which governs their license, solely because the physicians have no interest in regulating this procedure. If they did, the administrative costs and additional certification dues would impact the board's operations. Without these minimal safeguards, how do they intend to protect the public? Medical doctors with the same degree understand the importance of referring to a specialist. Orthopedists won't treat cancer, ENTs won't deliver babies. Why do professionals without invasive procedures in their scope get to appropriate acupuncture? It isn't about delivering the safest high-quality care. It's about an anti-competitiveness, collusion, and anti-Asian behavior in order to make a buck. Thank you.
Thank you for your testimony. You can get started.
Good afternoon, and thank you, Committee Chair, Vice Chair, and honorable members. My name is Lynn Vance. I'm a doctor of acupuncture. I'm also a registered nurse, and I'm the Vice President of Maryland of External Affairs for the Maryland Acupuncture Society. And the first thing I want to do is absolve my athletic trainer colleagues of responsibility for what I'm about to say. They didn't start it, right? And I very much respect their training. But I do want to provide some context and some history for the beautiful metaphor that Delegate Kerr provided here this afternoon, and discuss the bias that the entire profession of acupuncture has been facing since the founders of our profession in Maryland were actually jailed for performing surgery without a medical license. As a profession, we were required to create rigorous standards, and we complied. At the same time, we were prohibited from defining the practice of acupuncture in any medical terms as to not confuse the public that we were in any way practicing any kind of medicine. And now what you see with this beautiful metaphor and this attempt at somehow defining dry needling as separate practice from acupuncture, this compromise that our field, because of the bias, was forced to make is being used against us. Now that CMS has decided they're going to reimburse for acupuncture, and the AMA has decided that, acupuncture, they recommend it for first line of medical treatment. And going back till 2012, medical organizations, including the AMA and the Association of Medical Acupuncturists, actually have determined that the practice of dry needling is the practice of acupuncture, going back that far. And so what we're seeing now is an appropriation of acupuncture by stripping its definition of all cultural context and safeguards by other providers simply to have access to reimbursement and skirt the rigorous standards created to ensure patient safety that we are all upheld to, right? So 80 hours is just simply not enough to protect the public. So because of that, as the absolute experts in the use of a filiform needle and an acupuncturist, I am requesting kindly an unfavorable vote on HB 172. Thank you.
Thank you. Thank you for your time and your testimony today. Now I will open it up to the committee for questions. Are there any questions from the committee members? Delegate Johnson, followed by Delegate Taveras.
Thank you, Madam Chair, and thank you, panel, for bringing us the information. The one doctor spoke of injuries relating to dry needling. I wasn't able to find that. Could you give us the source of where we could find injuries from dry needling by the folks that are already performing that?
So I'll speak to that a little bit. And this is part of the problem. The way most boards operate when they punish a would-be licensee or a licensee that might have done something wrong. Some of those cases are sealed. Some of those reports don't see the light. Some of those reports are never reported to the board itself. I didn't want to say anything that was untrue, which I heard from several people talking about dry needling not looking like acupuncture. I know 3 people personally that have had pneumothoraxes, punctured lungs from dry needling. They don't want to be brought forward. They didn't want to, quote unquote, get the guy in trouble. So that statistic falls flat. Now, I was digging for something post 2016. I couldn't find the reference in time, but it looked like when they were looking at adverse events in the whole of dry needling, 1 in 10,000, which sounds like a great number, ended in a serious or major adverse event when it was 1 in over 100,000 for acupuncture. But because I don't have the source, I didn't want to present that today.
You can follow up.
Can you tell me, look, because these are other licensed professions that do not dry needling.
Yes.
So don't they have boards that those injuries would have to be reported to?
Yes, but not everything gets settled through a board. People can go through malpractice. The complaint could be settled out of court altogether. And certainly, unless there's a complaint that goes through the board and that channel, we may never know as board members.
Could the same be said about acupuncture?
Absolutely.
Okay, thank you.
My pleasure. Delegate Taveras, followed by Delegate Hill.
Thank you, Madam Chair. I'm going to develop a little bit on what Delegate Johnson just asked. what I see here in terms of, this is a document produced by the NIH, which shows that we're looking at issues of minor adverse events of pain, bleeding, and bruising. And there are, I can't pronounce it, pneumothorax and excessive bleeding and prolonged aggravation. And this study was double blind, all the sexy things that happen when we're doing all these things, when we're doing all this analysis. And this is basically out of 7,000. I'm a supporter of acupuncture. I've used it. It's helped me personally, in resolve my vertigo and those kinds of things. But when I look at this particular practice, it's very specific to muscular pain, and it's very targeted. We're not talking about controlling chi, digestive, mental imbalances, and so on, which I think that's why when I look at acupuncture, it's so much more specialized training. And that's why I would say you need that extensive level of body of work and training that required.
What's your question, though?
So my question is here, like, why, if you see these other states having all these different types of hours, like, why are we just targeting the muscular? Like, if we're just targeting muscular, why is this so negative?
It's not that it's negative to just target the muscular. What is part of the problem, and it speaks to my earlier testimony about this, prohibition that we faced in defining our medicine in medical terms. Dry needling is a part of acupuncture practice. So it is something that all of us learn. It is inherent in the language that we use. It's called Asher acupuncture, which directly inserts a needle into a trigger point in a muscle to generate a twitch response. Now, if that doesn't sound like dry needling, I don't know what does. That's my point.
That is the point.
That's exactly the point.
We're trained dry needling, as it's called, the Ashi point acupuncture in education as part of our education. It's not a separate thing. We're trained on how to focus on specific trigger points. And that's something that many people have come in because they know that it's a trigger point,
Right.
not just muscular.
And to add some context, the word Asher point, what that is a distinction from a named acupuncture point off of a meridian.
And it also is...
So many trigger points are actually named acupuncture points. Plus, within our practice, we are trained to palpate the muscle, locate an area of tension and find and locate a trigger point and activate it, causing a release of muscle tension.
Okay, thank you. We're
You're
going to go to
welcome.
Delegate Hill now. Thank you.
Thank you, Madam Chair. So you all were talking about master's level, doctorate level training and hours. But the first part of my question is, as I understand it, and I think this is sometimes where the committee gets confused, the expertise that people bring based on their healthcare training is not just hours, it's what those hours were in, right? And you're saying that your experience based on how they evaluate themselves and other independent analysis, that physical therapists have shown that they have a fundamental training that makes it safe with additional training for them to insert relatively large needles and have an understanding of the potential risk that, by and large, athletic trainers do not get. And so the additional training on how to use a needle won't help because they're missing the fundamental anatomic, physiologic understanding or something like that.
It's more that they're missing the physiologic consequences of what inserting a needle will do. And I don't want to, disparage the training of the athletic trainers versus the PTs or anything like that. I'm just here to talk about acupuncture practice. We have in our program, that's over 3,000 hours of okay.
Right, it's not the number of hours, it's what the hours were.
Well, what I'm trying to describe is 1,000 of our hours are supervised clinical training in order to be able to identify who should be needled, who shouldn't be directly. That came up yesterday in a meeting with the athletic trainers. How many of your hours are directly related to needling itself? It's 1,000 supervised clinical hours versus 80. So you see where we feel there's a discrepancy.
And so if I may, because
One last one, go ahead.
Thank you. With the risk of pneumothorax, obviously, everybody thinks they can do everybody else's job, right? We all think we can do somebody else's job. The question that I asked last year is if the primary risk that you're concerned of this broadened access to needling is heightened risk of pneumothorax, would it be allowable to say that athletic trainers or some other group can practice dry needling limited to the extremities and the buttocks, but are not allowed to dry needle from the shoulders, the neck, or would that still not adequately address the additional risk they may not understand that they introduce?
Correct. What we see in practice, if you Google right now on your computer dry needling, you will see pages and pages of egregious practice of dry needling where needles are retained in the body, where they're hooking up electrical stimulation, where they're never supposed to let go of the needle. You will see advertisements for dry needling for facial rejuvenation. You will see advertisements for dry needling for pelvic floor enhancement, and so on and so forth. So thus far, the history shows that limiting that kind of limit is only going to be on paper, as what we see. The true definition of dry needling, the needles are never to be retained. It's just to activate the twitch, pull the needle out. We don't see that in practice. We see all kinds of acupuncture practice being called dry needling. You're welcome.
Thank you. Delegate Bandari, followed by Delegate Gazzoni.
Thank you. What are the key differences, if any, between dry needling and acupuncture? Not in terms of their theoretical foundation, but in the techniques and clinical application, and how do these differences impact their effectiveness in treating? And if I'm a patient, how can healthcare professional help me make informed decision about which technique may be best suited for my individual need?
So I can speak, and I'm sure some other people probably want to say some things too. First of all, dry needling, and if we talk about one specific technique in acupuncture, because we know when to employ different styles, different manipulations of said needle. One thing is, you hear PTs, chiropractors, even the athletic trainers saying we don't go that deep. One of our trainings is in how deep you can put a needle. So the difference is, I'm going for a depth that is safe all the time based on these years of training. What we see is them saying, oh, we don't go as deep. We definitely go into the muscle. Acupuncture needles, long before the term was even coined, were in 6-inch, 8-inch. We even have one called a wheat shaft needle that is the length of a piece of, wheat.
You didn't have to say that.
Oh, sorry. Am I being... But we know when and how to apply those. Not everything requires a hammer.
Thank you. Delegate Gazzoni.
This is sort of a curiosity question. Is it at all reasonable to think of this in sort of a Venn diagram way, where there's a degree of overlapping aspects between these two fields. And I'm specifically thinking about the athletic trainer field, sort of setting aside PTs or chiropractics.
1 second, only one person will be allowed to answer. Who would that be?
Could you repeat the question, please?
I'm curious if it's reasonable to think of this as sort of a Venn diagram question. So there's acupuncturists and athletic trainers, and is it reasonable to think that there is a level of overlap between those? And sort of, I guess I'm thinking of this particularly in sort of the population that an athletic trainer would be working with, and the types of things that they would be treating, as opposed to the broader world, or at least what appears to be me to be the broader world of acupuncture. Is there a little bit of overlap there?
Well, there's an overlap in the sense that acupuncturists also treat musculoskeletal conditions, but the definition of dry needling initially was just in musculature and addressing the trigger points within the muscle. But acupuncture is much broader in scope than that. And in terms of the needling itself, I think that dry needling necessarily involves a more aggressive form of needling, lifting and thrusting, and that can cause damage to the immediate point if done over and over again in the same fashion, whereas an acupuncture wouldn't probably approach it in quite that way.
You want to follow up?
I'm not sure that I'm thinking about it in exactly the same way. So I'm not positive that I have words to change around. Thank you all
Okay.
for the opportunity, though.
You're welcome. Any other questions? All right, seeing none, thank you very much for being with us today.
Thank
We
you.
really appreciate it, okay? Next, we have actually 8 testimony left virtual. Okay, we're gonna take 4 favorable, since this was unfavorable, and then we'll go back to the unfavorable, all right? Andrea, and thank you, Andrea, for your patience. And maybe Delegate Gazzoni, you can ask your question to someone else, okay? All right, good afternoon. May we get started with Mr. Edward Strapped?
Good afternoon, Chairman. I'm sorry I cannot be with you. I do not have any fish for you, but I'm headed off to Switzerland next week with the U.S. ski team, so I'll be sure to bring some fine chocolates back for you.
Oh, that can I just say, that sounds delicious. And can I tell you, we would love to be out there because we've been in this room for hours, so go ahead.
I understand that. We're very lucky, some of us, to be out on sideline care and doing the things that we do. As you know, I'm Ed Strapp. I'm an athletic trainer, licensed healthcare provider here in the state of Maryland, looking for support for House Bill 172. I'm not going to relay and rehash everything that's been said. I'd like to make a few key points and end with a little piece. We're not defining what dry needling is. Comar has already defined that. We're looking to allow athletic trainers to practice within the scope. There's comments that our board doesn't care because they just aren't interested or there would be a financial impact. Our board already has a very established specialized task process in which an athletic trainer would be reviewed, and that's why it does not cost any additional and very little extra time. Dry needling isn't a sideline care. I'm not going to do this on a wet, rainy Thursday night on a soccer field. This is going to be completed in a controlled environment in an athletic training room that's already passed rigid standards. Our facilities comply with all universal precautions and all OSHA regulations. We understand and fully appreciate that an invasive procedure does take time, effort, and care to not cause any other adverse conditions. Not all PTs have master's degrees or doctorates. That's not the standard. The standard is that we have a licensed healthcare degree. So we have similar backgrounds. When you look at some of the recent studies, one looked at 20,986 dry needling treatments, had less than 20 with serious adverse complications, and 0 of those were pneumothorax. That's why this is a safe procedure. It is well within our practice as athletic trainers to provide the emergency care that's needed, and the background of the training in conjunction with this 80 hours of advanced training specific to dry needling. I appreciate your time and would be happy to answer any questions, looking for your support for House Bill 172.
Are there any questions for this witness? Delegate Rosenberg.
If I may, you referred to emergency care. Is that, I should know that if I had been listening more intently, but is that the only care that you can provide under this bill or not?
No, sir, that is in reference to their description that we could cause great harm to a patient if a dry needling procedure were to cause a pneumothorax. Of all providers that are listed to dry needle, athletic trainers have the most emergency care background for initial diagnosis, assessment, treatment, as well as referring them to emergency services if a pneumothorax would be defined. So that's what we're looking at is, are we prepared if an adverse effect were to happen? And athletic trainers have the most emergency care training.
Delegate Hill, followed by Delegate Taveras.
Thank you. Of the complications to dry needling that you mentioned, you said none of them were pneumothoraces. So what other complications to dry needling have been reported?
So, for minor complications, they look at just pain, bleeding, or bruising at the site, minor bleeding. For the adverse effects, one would be pneumothorax, excessive bleeding, or prolonged aggravation and pain. That was the way this study defined minor and major complications.
Okay, and may I follow?
Sure.
Thank you. And so, since athletic trainers have sort of their own area that they're really, really good at, just like physical therapy, you all have modalities. Why can't you just use the modalities that you use to treat the patients that you treat? And then if a patient needs dry needling, refer them to someone who has expertise in dry needling. Why do you have to perform dry needling in order for your patients to
athletic trainers are very qualified, and with the advanced training would be suitable for that. I think Colin and Sean both highlighted the complications with the student athletes' schedule and availability to major treatments. I'm pretty confident to say that nobody is hiring acupuncturists to be in their athletic training room all day for 1 or 2 treatments, numerous treatments. It's an availability and an access issue for the athlete or other patients that we treat. They're severely restricted in time. As we all know, everybody's pulled many different ways.
All right, Delegate Taveras.
No, thank you. So, I mean, I don't know if you heard the previous panel, but they're saying that they do, they do muscular vibrations. But I've also received muscular vibrations from physical therapists. Now I'm confused. Is it that one was more inappropriate than the other, or is it, and do athletic trainers use this methodology as well?
Correct. So, we're really talking about the wrench. All right, when car mechanic needs to do something, they use a wrench. When your plumber needs to do something, they use the wrench. When your contractor in your home needs to fix something, they use the wrench. All of us are using a wrench. So this is a wrench. This is another piece for us. Sometimes my fingers aren't enough to loosen that bolt. I need something else. I need additional treatment to treat that musculoskeletal injury where my fingers, electrical stim, ultrasound, cupping, instrument-assisted soft tissue massage, all of those are tools to. But if I can't reduce the nut and the bolt, I use another tool. I use a wrench. We all use the wrench. We use it in a similar way or we use it in different ways, but we're all using that same piece of equipment in a different way to get this. To go back for a second to Delegate Hill, she asked about access. I'm getting ready to travel with the U.S. national team ski team over to Europe for 4 weeks. I'm bound by my Maryland protocols. So I can't offer dry needling. I'm in another country. I'm going to be in Georgia. a very challenged medical country, this could potentially be a treatment that I would be able to offer, and they won't have access to it because I'm not allowed to do it here in our state.
Thank you. We have Delegate Hutchinson.
Thank you, Madam Chair. The previous panel, I think, had indicated that these are done in a dirty or unhealthy environment. And I know you're an N of 1, but are these done always in a sterile environment?
So I would not be the best one to answer that, but yes. We don't have a sterile environment from a standpoint of a surgical procedure, but we have a sterile environment. We have a clean environment. The needles are sterile. The skin is sterilized. Those would all be done. And that's a huge piece to the training, is how to safely needle. When, why, and how. And the how is safely doing it. So correct, I'm not going to do it on the sidelines, 10 minutes before a player goes into the game. I'm going to be doing this as a pre-treatment, a post-treatment, a recovery treatment in my athletic training room that has safe precautions, that is guided by OSHA regulations to allow this to be safely produced. The entire University of Michigan athletic training staff has dry needling capabilities. They do it in a very safe environment in their athletic training room with the appropriate care.
Thank you.
Any other questions for this witness? Seeing none, thank you so much. Safe travels to you.
Thank you, ma'am, and I'll be sure to get some good Swiss chocolate to you.
Thank you. We're going to go next to Adrian Dixon, followed by Miss Emily Hildebrand.
Good afternoon, Chair and Committee. My name is Adrian Dixon. I'm the head athletic trainer for the Baltimore Ravens Football Club, and I'm here today in support of passage of House Bill 172. I believe as a healthcare professional, we have a duty to serve our patients in a manner that seeks to provide the best care possible. In speaking about the patient population that I serve, which is professional athletes, I strongly believe as an athletic trainer, I should have the ability to provide this method of treatment for our athletes. I happen to be a physical therapist as well, and legally, as was said before, this is the only way I can provide that treatment. In the previous state that I practiced in, which was Tennessee, dry needling was also not within the scope of practice for athletic trainers. This put an undue burden on me personally, as I was the only dual credential professional on staff, which is what an athletic trainer would have to be. And that was extremely demanding and inefficient. Teams seek to hire athletic trainers as it is demonstratively clear that we're the most suited and equipped to work in the athletic setting. If you need proof of this, we all witnessed that Buffalo Bills player a few weeks ago. I have also worked in the state of Texas where athletic trainers do have the ability to provide dry needling to their athletes. It truly bothers me as a competitive person and drive in me to know that Dallas Cowboys and the Houston Texans can be more efficient and effective in their treatments. In theory, that could give them a competitive advantage on us. I support the passage of this bill 100% because I believe athletic trainers in this state are well suited to be able to provide this treatment safely and effectively. If there's any doubt, like was said before, I would point to the 28 other states and the District of Columbia who already allow athletic trainers to dry needle. Additionally, personally, I have 8 years of dry needling experience with no adverse effects. It's time to advance the scope of practice for athletic trainers in this state, and this is more than appropriate because any medical professional would attest that the knowledge evolve, your practice should also evolve. So I want to personally ask you to help me help the Baltimore Ravens deliver the best care by passing this bill. Thank you.
Thank you for your service. Are there any questions for this witness? Seeing none, thank you very much. We really appreciate you being with us today. Thank you. Ms. Hildebrand.
Yes, thank you. Good afternoon, everybody. Thanks so much for sticking with us here and to the last bill. So as stated, my name is Emily Hildebrand, and I'm an athletic trainer. For more than half of my 17-year professional career, my PhD is in teaching and administration, which lends to my role as faculty in the athletic training program and the director of the athletic training program. As the director, I'm directly responsible for ensuring that our program upholds all accreditation requirements, and I manage a lot of the recruitment as well as teach in the program. For students to consider enrolling in a graduate AT program, prerequisite coursework in biology, anatomy, physiology, chemistry, physics, and psychology are required per accreditation standards. Once enrolled in a program, in-depth coursework surrounding the evaluation, management, and treatment of orthopedic, emergency, and general medical conditions occurs. There are only 2 athletic training programs here in Maryland, and both have students taking around 60 credits. And that's really up to the institution as what they want their graduate program to be capped at in terms of credits. Once those credits are complete, they challenge that national board exam. But to truly understand how much learning occurs in athletic training programs, you need to know how those credits are counted. After you add up lecture coursework, hands-on laboratory coursework, and clinical rotation hours, students put in around 1,850 hours of education. Then you also should factor in that students average about 2,000 patient contacts during one clinical rotation. I'm not here to scrutinize the education of other healthcare providers. It is truly a privilege to work alongside them, nor should I need to defend why my graduates are competent clinicians, in which some have successfully exam. I'm here to simply ask support of HB 172 because my graduates have the same opportunities to use this skill set in Maryland to effectively contribute to our overall organized health.
Are there any questions for this witness? Seeing none, thank you so much for being with us this afternoon. Next, Mr. Brian Perez.
Good afternoon. My name is Brian Perez. I'm a certified athletic trainer in the state of Maryland, coming to you today in support of House Bill 172. Emily, Ed, Adrian, and the rest of the athletic trainers who you've spoken to today have done a wonderful job speaking very eloquently about our training and the education that we as athletic trainers receive and what should make us eligible. I want to make 1 or 2 points of clarification, and I will cede my time. I want to add 70% of athletic trainers have master's degrees. So this isn't a question of athletic trainers coming out of fresh grads, really green grads coming out and just wanting to dry needle. It's not that, this is not the case. Informed consent has been, and always will be present in the field of athletic training. Athletic trainers do not bill for specific services. We are not, as athletic trainers, making money off of any treatment that we provide in the traditional clinical setting. So it's not, as terms of a cash grab, I feel that is not a true representation of why athletic trainers would be looking to gain this skill. Athletic trainers in the state of Maryland don't want to do others' jobs. We just want we want the ability to seek an advanced skill that national organizations recognize athletic trainers, that we meet the requirements to take the course to acquire that advanced skill. That is all we're looking for here. Thank you very much. I cede my time.
Thank you, and thank you for your time today. Are there any questions for Mr. Perez? Seeing none, thank you for... Go ahead. Delegate Taveras.
Thank you, Madam Chair, for granting this. You're saying that since no one is compensated, so are you saying that the athletic directors or the athletic trainers that are using this methodology are strictly within the realms of either in the NCAA or in professional teams, and that this wouldn't be the same market that would of individuals that would be visiting an acupuncturist?
There definitely may be overlap in some of those patients who may seek our services. However, in an athletic training setting, in a high school athletic training room, college athletic training room, or in the professional ranks, individuals, athletes, patients are not paying for the service they receive in our athletic training room, in our athletic training clinic. That was the clarification.
Okay,
Thank you. Any other questions? Seeing none, thank you so much for being with us
Thank you.
today. We really appreciate it. We are now going to the last four witnesses of the day, and they are unfavorable. Can you see if you can bring them up? Thank you. Thank you for your patience, everyone. We're going to start with, actually, who would like to get started? Go ahead.
If possible, me.
All right, go ahead, Mr. Adams.
Hi, my name is Aaron Adams, and thank you, Madam Chairwoman and members of the committee for having us. Currently, I am the Human Performance Lab Coordinator at Louisiana State in Shreveport. I took my initial education in Maryland at the University of Integrative Health, and that's where I got my degree in acupuncture. I am in a unique position here at the Human Performance Lab to where I can interact with players, coaches, athletic trainers, PTs, occupational therapists, all different kinds of people. And one of the things that I think is most important is that everyone leans on each other for what their expertise is. And I can't tell you how many times they want to get an acupuncturist actually in the room. One of the things that I think was said earlier, if I was listening correctly, was that athletic trainers want to use these in emergency situations, right? Like on the field situations or after when they're coming back to the training room. I can't think of a single time where, as an athlete, because I was an Olympic athlete representing the United States in weightlifting, that I ever had a musculoskeletal injury that was an emergency, that wasn't able to be filled with some other way. I think that's a little bit of an overscope. I think that they're trying to step over top where there's a lot of really good, especially in Maryland, perfectly good acupuncturists that could help. And they're highly trained and very knowledgeable in this industry and in this medicine. Also, in my written testimony, I gave you guys two studies. They were meta-analysis, and I think it was Ms. Taveras, if I remember correctly, that was citing some different studies. In these two meta-analysis, they take thousands and thousands of studies. In one study, acupuncture was shown to actually help musculoskeletal pain over a long-term period of time, and dry needling was not. So either dry needling does not work for musculoskeletal pain in the long term, or it does work and then it's acupuncture. And then at that point, that's where I think it splits. And I think that's really like the main argument here. I can't.
You can take your time and finish.
Thank you. I can't see why, especially in Maryland, where there are so many acupuncturists that are available in comparison to athletic trainers, why we would take this entire population and ignore them for only 80 hours of training. And thank you. I hope that you guys will vote for an opposition of House Bill 172.
Are there any questions for this witness? Okay, seeing none, thank you so much for being with us,
Thank you
Mr.
so much.
Adams.
You guys have a great day. Enjoy that Northeast weather.
Hey, you too. Take care. I have next Miss Diane. Is it Jososo? How do you pronounce it?
Yoso.
Okay.
Thank you, Madam Chairperson, for your deep listening today for all the bills in front of you. I am Diane Gioso, and I oppose the bill from 3 vantage points. One as a practitioner of Chinese medicine in Maryland and DC for over 2 decades. 1 as a national educator of Chinese medicine. And 3 as a mother of a 16-year-old son who received services of athletic trainers in high school. From each of these perspectives, I believe adding dry needling to the scope of athletic trainers would be hazardous to the safety of Marylanders. In previous testimony to the House Committee, a claim was made that, quote, dry needling is allowed by athletic trainers in 28 states and Washington, D.C. This is false. I practice in D.C. Athletic trainers do not have dry needling privileges in Washington, D.C. The D.C. Board of Medicine, which is the governing body, has confirmed this is not the case and are asking for reports of this violation of law. The misrepresentations of the scope of practice in DC leads us to question the claim in other states. I do believe that further investigation is needed and a slowdown of the entire expansion of scope. And with all due respect to Delegate Carr's opening statement based on a completely out-of-date understanding of acupuncture in terms of scientific and within Chinese medical educational communities. I encourage the entire body to look for, and I'm happy to provide them, understandings of our medicine, which is current with scientific investigation, cultural competency, and are not xenophobic. As a mother, I will remind the committee that only a small number of athletic trainers are serving elite athletes. Many are in local gyms and working with our children in schools, including my son in his high school. He has received athletic training services on wrestling mats, curbs, courtside, and in muddy fields. In this bill, athletic trainers are asked to perform medical services with medically regulated devices, the filiform needle. As an acupuncturist, I use the exact same needles and have for 21 years. I must use them in clean sterile fields and use clean needle technique. To treat a minor, I must have releases from parents and disclose risks prior to needling. These include neurothorax and nerve damage. How would Maryland enforce and fund regulation of proper clean needle conditions for minors and in these gyms, schools, and other outdoor environments? May I continue, Madam?
Just start wrapping up, please.
I also have great concern of record of adverse events. In many states, the adverse events from dry needling are recorded as acupuncture adverse events because they are using acupuncture needles. They do not separate the adverse reporting by profession. If this statistics was reported by profession each state, you would see that dry needling by physical therapists are the cause of 90% of adverse events. Then that is from the Freedom of Information Act, combing through each and every event state by state. Dry needling is very vigorous needle stimulation and a deep retention of these needles. Why would the state's return of adding this to the scope of practice if you have the ability to study acupuncture with established record of safety? I see injuries. I've included in my written testimony.
You have to wrap up, okay?
One by a cancer patient who had brain cancer was also dry needling for her cancer in her head. We have lots of prohibitions in our education around areas and reasons not to needle those areas.
Thank you. Thank you very much. Are there any questions for this witness? Seeing none, thank you so much for sharing your experience with us. We appreciate it. Next, we have Dr. Tyson.
Oh, good afternoon, Madam
Good
Chair, Vice Chair, and the committee. I'm really pleased to be here to talk to you about opposing this bill. I want to speak to you about the fiscal and policy note that is attached to this bill. What I want to say is that what I noticed with the small business effect, that there is no analysis or account to the effect this bill will have on acupuncturists. The majority of acupuncturists are small business owners, mostly women. We fit into a minority disadvantage category. And most of us are not eligible or don't have opportunity to have jobs like the other professions that we've been speaking about. Because of this, it's really important that the public has a clear definition of what we do and what we offer compared to other health providers. And it's been our experience that because of the dry needling, a lot of people are confused. They're confused about who should be providing it. They're confused about the education and the injury that comes about. I've had patients who have come and said, I had pneumothorax, I had nerve damage, I was paralyzed in my leg, and I had this acupuncture. I said, who provided? They said, well, the physical therapist. And I say, well, there is a difference. And they know that right away. And in our extensive study, thousands of hours of supervised clinical practice and didactic study, we also learned Western medicine.
You can take your time and
sorry.
finish your thought. Finish your thought.
What I was saying is that because we're exposed to Western medicine and biomedicine, we're taught this, so we're informed about how to refer. And we just think that it should be done on the other side too, that they also are learning the traditional Asian medicine, at least the background of it, and so that they're able to know when and why to refer back to us. Thank you.
Thank you for your time and your testimony today. Are there any questions for this witness? Seeing none, thank you for being with us. We really appreciate you. And we have our last witness, but that doesn't mean we're not going to pay attention to you. Why don't you tell us who you are and tell us
Hi.
why you're here?
Thank you, Madam Chairwoman, and to Madam Vice Chair and all of the committee members. Thank you for having me. My name is Dr. Callie Bird-Guyman. I am the founder of AcuCongress, but I also, up until last year, was a licensed acupuncturist in the state of Maryland who studied at the Maryland University of Integrative Health for my doctorate and my master's there. And I'm talking to you today as a patient and as somebody who had 200 patients that were mostly high school athletes that I needed to refer to other licensed acupuncturists when I left the state. I was there last week to testify before the Senate. I am a double amputee that is ambulatory, and so I end up with multiple issues that have to do with balance, vertigo, and pain. Now, I have a massive headache from all of this today, from walking around last week. And because I'm a licensed acupuncturist, I can stick this needle right here in my hand, just like that. Now, because I am a licensed acupuncturist, I can still move my hand, but that's not true if you needle the belly of a muscle. So I want to talk about what is the same. So this needle, don't let it fool you. Athletic trainers will tell you that they don't needle distal points, they needle over the body. So I guess what I want you to see is how many acupuncture points they are actually needling while they are actually putting needles in for local pain management. Now, what is also similar, you can't see this needle, it's the size of a human hair. However, this needle will still puncture a lung if you are needling over any of these points on the upper body, on the shoulder, or along the back. Now, what is absolutely similar is they will still have to refer out to an emergency room for the same practitioner, a thoracic surgeon, who will have to perform the same procedure, which is a thoracotomy, in order to fix their mistakes. That would be less likely if they had some understanding of acupuncture and the theory that would keep them from hurting people. Thank you.
Thank you. Are there any questions for this witness? Seeing none, thank you. And thank you for making it interesting, being the last witness and making it interesting. It woke us up. We were awake already. We were awake. Actually, very much awake for many hours, listening to this bill that is very important on both sides. This is a committee that we listen to both sides. We will certainly, assign it to the right subcommittee, and it will be worked, and people can still come again and testify. So it's a thoughtful committee. It's a thoughtful process, if I may say. In any event, thank you for being with us this afternoon. There are no questions. Thank you all for being patient, and we hope you have a blessed evening, okay? Thank you. And when we're done, if the committee can stay for a second. Let me know when we're done. Okay.